Hello everyone. Very good evening to all of you. Am I clearly visible, audible? First, you have to confirm that I'm clearly visible, audible, everything is good to go. So I will start the session. I'm waiting for your reply in the comment section. Those who are live, those who can see me clearly, you can reply that I'm clearly visible, audible, everything is good to go. I guess yes. Yes, thank you. Thank you so much for responding. Thank you so much. So I welcome you all for today's session. Good evening to all of you. And I welcome you all for this course, that is Third Prof Buster 1.0. So today's topic is very interesting topic, very interesting subject. So today there is a demo session of the forensic medicine in which I'm going to take a ultra important topic, that is postmortem changes. This topic is really very important from MCQ point of view in the competitive exams, and it is also very important for the university exams. Okay, so before coming on this topic, as most of the students who are attending this session may be third prof student, so I would like to orient a little bit. Okay, I will take few seconds only. After that, quickly I will come on the topic. Okay, so first of all, I would like to tell you why third prof is most important. Many students take third prof so lightly. They think only 2 subjects or only 4 subjects are there, and the syllabus is very less, and they take third prof very lightly. But please, let me remind you, in the final year, you are having 9 to 10 subjects. Yes or no? You are having 9 to 10 subjects depending from university to university in your final year. So if you are starting third prof early, finishing it early in the next 4 months along with me, you can start your final year subjects very soon. Okay, you will get a spare of 4-5 months to study the final year subjects. If you are completing these 4 subjects timely, you will get time to start at least few major subjects of the final year timely this year only, in the third prof only. You should cover at least 2 or 3 major subjects in the third prof, because in the final prof you won't be able to cover all the 9-10 subjects, right? So considering all these struggles the students are facing, the third prof students, I have launched the course, that is Third Prof Buster 1.0, in which I will teach all 4 subjects. Okay, and these 4 subjects I will not teach only from university point of view, university exam point of view. I will teach all these 4 subjects for university exams as well as for your competitive exam. I mean to say, if you are attending math session, you can solve all the MCQs, PYQs, probable MCQs based on these 4 subjects 100%. So these 4 subjects will be prepared for your NEET PG, INI-CT, and if you are a foreign MBBS student, it will be for FMG also. It will be useful, and it will be simultaneously useful for your university exams. So daily I will take live classes in the evening, so that it will bring discipline in you. I want all of you to attend it live only. And if you take the subscription and you think that I will watch the sessions later on, later will never come. No, you have to attend it live, so that along with me in the next 4 months, you will complete your syllabus of all these 4 subjects. Okay, so that is the broad plan. So we are going to complete the 4 subjects in the 4 months, 10 days to be precise. The starting date, it's already started 2 days back on 11th of October. The end date is 22 February. So it's 4 months, 10 days. The detailed schedule is in front of you. You can see the color coding of the subject. Okay. Now here, along with the daily live sessions, recordings of the sessions will be available for 1 year. I'm providing you 3 types of notes in this course. Digital notes, printable notes. You can take the printout at your convenience and mark it, annotate it. Okay, and annotated digital notes. Okay, I will provide you daily quiz. 3 types of question banks here: university exam question bank, NEET PG question bank, and PYQ question bank, along with the practical library. So these are the inclusions. FMT and PSM are the subjects in which images are very less. Okay, most of the students feel that they are very dry subjects. You may have seen the textbooks, they don't have much images, but in my lectures you will find these 2 subjects most colorful. Today you will get a demo. You have already seen the PSM demo. Now in forensic medicine, you see how many images, animations, tables and flowcharts I have included, so that you have better retention. For ENT and ophthalmology, the 2 clinical subjects we are having, I will teach you with 3D models like this. I'm having all these 3D models. I will teach you layer by layer, part by part in ENT as well as ophthalmology. So don't you dare to miss my demo classes of ENT and ophthalmology ahead. After FMT, we are having the demo classes. In this course, I'm going to take total 87 live session, 2 to 3 hours each. Daily live session, it will be daily with breaks, pre-planned breaks, and total 87 sessions are there. There are 8 demos. Today is the 3rd demo. PSM demos are over. Today is first forensic medicine demo. Tomorrow will be the second one. After that, we are having ENT opthal demo. So I request all of you to attend all these 8 demo classes because the topics here I am taking are ultra important. Whether you are subscribing or not, that's a secondary issue, but these topics are ultra important. You should cover for your exam that we will take in the demo classes. Okay, chalo. For the notes of this session, whatever I am taking it, in the comment box, you will get the link. Whatever I am teaching, the replica you will get in the form of the notes in the comment box. So you can download from there right now or later on if you wish. For any further details, you can WhatsApp on this number. Don't call on this number. Kindly drop a message. WhatsApp on this number. Now, let's start forensic medicine. How many of you are ready? Can we start forensic medicine? So today is the first demo session of forensic medicine. Excited? Yes. So let's start forensic medicine. Before I come on the topic that is postmortem changes, I would like to introduce the subject a little bit because it is the first lecture of forensic medicine. So what is forensic medicine? What is forensic medicine? Death ends life, but not the story. You believe it? Yes or no? And that's where the forensic medicine begins. So forensic medicine begins after death. It's a science that begins after death. Okay, so we can say in medicine, we learn how to save one life, how to save patients. Okay, but in forensic medicine, we learn how to let the dead speak. How to let the dead speak. That is the science, very interesting science, the forensic medicine. Okay, so silence after death is not empty. Okay, and it's full of the clues. It's only thing we have to pick up those clues. So I welcome you all in the science of forensic medicine where doctors become detectives, right or wrong. So let's start the topic now. Postmortem changes, my first session in forensic medicine. Can we start it? Are you people ready? Yes? Interesting? Sounds interesting? Yes? So let's start postmortem changes. Now the first question which arises in my mind before I start this topic, I guess you also have this question in your mind. Why? Being a doctor, it is important for me to know the postmortem changes. Postmortem changes are the changes which occur in the dead body after death, obviously. Okay, in the body after death. So these are the postmortem changes. Why? Why it is necessary to study these changes in this lecture today? Being a doctor, why it is necessary? So listen, every second after death, every second, the dead body starts writing its own report. Everything turns into a clue. What is our job? Doctor's job is to read those clues, and we have to tell two things: when the death occurred and how the death occurred. To answer these two clues, we have to understand the postmortem changes in the body. So we have to answer two questions from the clues, because immediately after death, changes start taking place and clues are there. We have to pick up those clues and we have to answer two questions. When the death occur, what is the approximate timing of death? In case of medical legal cases, it's very important to know the timing of the death. Okay, and how death occur. Okay, what is the cause of the death? In medical legal cases, it's ultra important, obviously. Okay, so at the crime scene, there is no stethoscope, there is no pulse, there is no patient, there is a dead body and only questions. There is only questions, and the answer of all those questions lies in postmortem changes, and that's why postmortem changes are ultra important. So I welcome you all in the science where doctors become detectives. That is postmortem changes. Now you understood the relevance of postmortem changes. So let me start the topic. Now you have to understand that term, the definition. You have to understand this term. Sometimes you get a short note on that. What is forensic taphonomy? Forensic taphonomy. Say the word with me. Forensic taphonomy. What is that? It is an interdisciplinary study of postmortem processes. So this study is known as forensic taphonomy, first of all. Okay. With the help of this study, we examine history of changes in human body after death. So we see the changes in human body after death. And this study is known as forensic what? Forensic taphonomy. Write down this word. It is important for MCQs also. Now, what is the uses of forensic taphonomy? The same two uses. Number one, with the help of this study, we can differentiate true death from suspended animation. What is suspended animation? Suppose there is a person who is unconscious and I cannot find the pulse, I cannot find the respiration. I think the person is dead, but actually the person is not dead. Temporarily the pulse and respiration is suppressed to such a level it cannot be detected. So person can be resuscitated. Okay, so it is not a death, it is not a true death, it is known as suspended animation. The person is looking like death, but it is not a true death. So with the help of this science, we can differentiate the true death from suspended animation, number one. And number two, of course, we want to know time since death in case of medico-legal cases. The most important thing, when the death occurred, the approximate time. That's ultra important clue in medico-legal cases. So for these two purposes, we are performing this study, that is forensic taphonomy. Learn the definition, learn the two applications. See the images, learn the two applications. Okay, to differentiate the true death from suspended animation and to know the approximate time of death. Don't mug the statements, understand and try to create in your own words. Okay, now, so with the help of postmortem changes, okay, suppose I am a forensic expert and I am examining the postmortem changes in a dead body. So even a single clue from the dead body can set an innocent person free and can send a murderer to the prison. So it's the onus of the forensic expert who is examining the postmortem changes in a dead body. It is the onus of this person, because of which the judge can decide, okay, the justice can be given, the innocent person can be set free, and the murderer or any criminal can be put into the prison. So it's a very important study. Now, if you have understood the introduction, definition, applications, let's start the changes. Okay. So since last 15 minutes, I'm stating about the definition, its application, its uses, how it is useful for us. Now we will come on actual changes, the postmortem changes. We divide postmortem changes into three categories. What are the three categories? We divide the postmortem changes into three categories. You can see the three categories: the immediate changes, early changes, late changes. First, you learn the three categories. When immediate changes are seen, it means somatic death has occurred. But at cellular level, death is not there. Only somatic death is there. Okay, first somatic death occur, then cellular and molecular death occur. Okay, so early changes indicate somatic death. Immediate changes indicate somatic death. Early changes indicate cellular death. There are 6 early changes. And there are 3 late changes, which indicates the body is decomposed. Decomposition, putrefaction, mummification, I will teach you all. So body is decomposed. So what are the 3 type of changes? Immediate, early, late. Don't get confused between immediate and early. Immediate, early, late. Immediate changes are 3 in number. You can see, I will teach you all of them today. Okay. Early changes are 6 in number. You can see. And late changes are again 3 in number. So 3 plus 6 plus 3. Total 12 changes. Today's topic. Okay, it's a long question in your university exam. And you get ample of MCQs from this topic. You are getting my point? Yes or no? Yes. So immediate changes, early changes, late changes. Learn the total 12 changes one by one. So one by one we will see. Okay, come on, the immediate changes. There are 3 immediate changes. What are the 3 immediate changes? And what does they indicate? Immediate changes indicate somatic death. Early changes indicate cellular death. And late changes indicate decomposition. First, you learn the 3 type of changes and learn what does they indicate. Okay, now learn the number. How many changes are there in each category? Now state them. One by one, we will state and see their description. Okay, immediate changes are 3. What are the 3 immediate changes? Number 1, insensibility and loss of voluntary power. The person become unconscious. Obviously, a dead body, dead person is unconscious. Insensibility, there is no sensibility. There is no pain sensation, no sensation at all. Insensibility, the sensations are gone. And loss of voluntary power. Okay, number 1. So as soon as a person is not responding to any sensation, okay, so we have a suspicion the person can be dead. Number 2, cessation of respiration, cessation of circulation. 1, 2, 3. Learn the immediate changes. Okay, how to learn them? You will see, ma'am, I have difficulty in learning them. So I'm having a mnemonic for this also, this also, this also. We will see 3 mnemonic. First, you see the mnemonic of immediate changes. The mnemonic is I really collapsed. IRC. What is the mnemonic? IRC, the immediate changes. I stand for insensibility and loss of voluntary power. insensibility and loss of voluntary power, like that. Okay. Number 2, R. R is respiration, cessation of respiration. And number 3, C. C is for circulation. So cessation of circulation, no pulse. Cessation of circulation. So cessation of respiration, cessation of circulation, and insensibility. You can learn the mnemonic I really collapsed, IRC, if you want. So these are the 3 immediate changes we have learned with the help of a mnemonic. Coming on, I will give you detail of all of them. First learn them, no? You can be able to enumerate the 12 changes. Then only I can give you the details of all 12 one by one, right? First you should be able to enumerate, no? So second is early changes, which indicates cellular death. There are 6 changes over here. What are the 6 changes? Changes in skin, changes in eyes after death, changes in skin, okay, changes in eyes, okay, muscle changes, the muscle changes, okay, cooling of the body loses temperature after death, cooling of the body, that is known as Algor mortis, okay. Postmortem lividity, there are many, hypostasis, it is also known as, and then rigor mortis. I will explain all these. These 3 are ultra important. They come for long question, the remaining come for shorter, very short question, and MCQ come on all of them. Okay, how to learn that? Use them. I will forget. I'm having a mnemonic. You won't forget. In my class, forgetting is not allowed. Okay, you won't forget in my class. So there is a mnemonic. What is the mnemonic? See me clear. See me clear. This is the mnemonic. So from C, take 2 letters. SE. From me, take 1 letter. M. And clear, take 3 letters. CLR. Clear. See me clear. C, S-E. So the mnemonic is C, me. Me ka M. Or clear ka CLR. See me clear. So S stands for skin, changes in the skin. E stands for eye, changes in the eye. And stand for muscle changes. Okay. C stands for cooling of the body. L for lividity, postmortem lividity, hypostasis. And R for rigor mortis. Very easily you can enumerate if you have the mnemonic with you. So these are the 6 early changes. We are done with immediate changes. You have your mnemonic ready. We are done with early changes. Mnemonic is ready. Now coming on the last, late changes. Late changes are only 3 in number and they indicate the body is decomposed. Decomposition, putrefaction have started. So there are 3 changes: putrefaction, adipocere formation, and mummification. The mnemonic is PAM, P-A-M, PAM. PAM for afterlife. P-A-M, PAM afterlife. So P for putrefaction, A for adipocere, and M for mummification. So total 12 changes in front of you which you have learned with the help of the mnemonic can be tried together. You can see total 12 changes in the form of the table. If you want to learn like this, learn like this. If you want to learn like a flowchart, learn like flowchart. Whatever fits in your mind. But learn the mnemonics. IRC, see me clear, PAM. Can we revise it once? We will do it. Huh? Chalo. So post-mortem changes. We are dividing them in 3 categories. Immediate changes, early changes, late changes. Immediate indicates somatic death, early indicate cellular death, and late indicate decomposition. Now say the mnemonic. What I told you, the mnemonic. Write down in the comment box, please. Say the mnemonic, people. What's the mnemonic over here? I really collapsed. Okay. Insensibility and loss of voluntary power, cessation of respiration, cessation of circulation. Early changes, C, me, CLR, clear. Changes in skin, changes in eye, changes in muscle, cooling of body, and lividity and rigor mortis. Okay. And finally, here late changes are PAM, P-A-M, PAM, putrefaction, adipocere formation, mummification. I hope it's crystal clear. Can you enumerate all these 12 changes? Everyone who's live, give me a thumbs up. You are understanding it. You are retaining it along with me. Now, one by one, we will start these changes. Description of all these 12 changes one by one. But before that, I told you, just a second. I'm sorry. Before that, I told you it's very important to differentiate the true death from the suspended animation. So you must understand what is suspended animation before I start postmortem changes. Postmortem changes are seen in dead body. This is not a dead body. It is suspended animation. So being a doctor, you should be able to differentiate what is the true dead and what is suspended animation. So how to define suspended animation? Before I come on the details of all these 12 changes one by one, I will come on the detail. You should understand what is suspended animation. Suspended animation, the other name of suspended animation is apparent death. What do you mean by apparent death? Apparent. It is looking like that, but it's not real death. That is the meaning of apparent. Uske jaisa lag raha hai. It is looking like that, but not real death. Okay. So it's a condition where vital functions are reduced to minimum. You can see the vital functions are not zero. The circulation, the respiration, they are reduced to such a minimal level that no visible signs of life are there. If I auscultate with a stethoscope, I can't hear the respiratory sound. If I see the pulse, I can't palpate the pulse. Okay, because the vital functions are reduced to minimum, they cannot be detected, but the resuscitation is possible. If you resuscitate this person, the life will come back because vitals are not zero yet. Okay, pulse is not palpable, but if you resuscitate, it will come back. So this is suspended animation. So in suspended animation, why the person is not respiring, still alive? The question may arise in your mind, now circulation is not there or minimal circulation is there. Respiration is not there, minimal respiration is there. But still the person is alive. How? From where the person is bringing the oxygen? So oxygen, because the person metabolic rate is reduced to such a level so that the oxygen which is dissolved in the body fluid, that is sufficient for maintaining life for the next few minutes. In the next few minutes, if the person is resuscitated, in the next few minutes, we can retrieve the person. You got my point? So here the oxygen is not taken by respiration. The person is not respiring. Okay, it's minimal. But the metabolic rate is less. So oxygen dissolved in the body tissue is sufficient for that. There are two types of suspended animation: voluntary, involuntary. Voluntary suspended animation can be done with yoga training. Okay, with yoga training or deep meditation, person can withhold his or her breath and circulation and pulse also. So it is voluntary. Sometimes it can be voluntary, like in yoga training, yoga samadhi, deep meditation. Okay, and sometimes it is involuntary. Involuntary in some diseases like drowning, electrocaution. You can see drowning may in case of electrocaution, and in case of vagal inhibition, hypothermia or drug poisoning. So these are the two types of suspended animation. You can see in case of yoga, it's voluntary. In case of drowning, electrocaution, vagal inhibition, it's involuntary. So these are the two types of suspended animation. It can be from few seconds to half an hour. The person can be in this state from few seconds to half an hour, and revival is possible with the help of cardiac massage and electric stimulation. Okay, we can do the electric stimulation and cardiac massage, and revival is possible. So that is about the suspended animation, a short note on suspended animation. So if you are getting a short note on suspended animation, you can write it down. Okay, now can I start the changes one by one? How many of you are ready? Give me a thumbs up, everyone. Can we start? So let's start it. Let's start the changes. First, I will teach you immediate changes, which are 3 in number, one by one. Then I will come on early changes, which are 6 in number. And finally, I will come on late changes, which are again 3 in number. Total 12 changes. Today's challenge. Okay, so let's start with the immediate changes, which are 3 in number. The mnemonic is IRC. We will revise it again and again. So I will start with the first change, that is insensibility and loss of voluntary power. So you can see out of the 3 changes, I'm teaching you the first one, that is immediate changes. And I'm starting with the first one, that is insensibility and loss of voluntary power. So it's an MCQ. What is the earliest postmortem change? You get multiple options among these. So answer is this one. This is the earliest postmortem change. Please learn it. And this is the last one. Okay. So this is an MCQ. Learn earliest sign of death. The earliest sign of death is insensibility and loss of voluntary movement. The person become insensitive, no response on anything, and there is loss of voluntary movement. That is the earliest sign. Sometimes it can mislead if precaution is not taken. Okay, it is not always if the person is not responding, the person is dead. The insensitivity can be seen in all of them. The person can be fainted. Maybe this person is not dead. Maybe the person is fainted, syncope, or maybe it is vagal inhibition. Maybe in epilepsy, catalepsy, necrosis, or electrocaution, it occurs. So sometimes it can be misleading, but it is the earliest sign. That's it. That's it. Okay. So sometimes insensibility and loss of voluntary power can be misleading, but it is the earliest sign of death. Number one. Coming on the second one. The second one is cessation of respiration. R for respiration. Cessation of respiration. Cessation of respiration must be complete and continue to confirm death. I told you, in suspended animation, it is for few seconds or few minutes, but it's incomplete. It is reduced to minimum. It's not zero. In suspended animation, for confirming death, you should hear with the stethoscope very clearly. There is zero respiration. Zero. It is not minimal. It should be complete absence of respiration, complete cessation, and it should be continuous. It should be continuous to confirm death. Okay. Sometimes it happens, very expert physicians, very expert doctors declare death of a person, and later on it is found that it is not a true death, it is a suspended animation, and in the mortuary the person gets up without even resuscitation. So some incidences in the world have happened which are reported like this. That's why looking at these signs is very important, okay, with clarity. So there should be complete cessation and continuous cessation of respiration. So how to examine the respiration? You should take a stethoscope. Being a doctor, if you want to see whether this person is dead or not, you should take a stethoscope and put it on the upper lungs and larynx. And you should be able, even the faintest breath sound, if you are hearing it, is not dead. It is suspended animation. If the faintest breath sound are also there. But if there is no breath sound and it is continuous like that, even after trying resuscitation, okay, so it is dead. Okay, complete absence of respiration for more than 5 minutes declares death. So mind the word complete. Complete. You should be able to hear it clearly in your ears. There should be no even faint sound. So complete absence of respiration, learn, for more than 5 minutes. It's an MCQ. For more than 5 minutes, it can be declared death. Okay, and it should be heard on upper lungs and larynx. Here is the upper lungs, and it should be heard on the larynx. Upper lungs and larynx. Okay. Temporary stoppage, not true death, can occur in voluntary breath holding. I told you, in yoga practitioners, it can happen. Voluntary breath holding, it can occur in drowning, newborn infants, sometimes it occurs, and it can occur in Chinese stroke breathing. Okay, but you should be able to differentiate that it is not suspended animation, it's a true death. So these are the differential diagnosis over here. Okay, so we are done with the first one. We are done with cessation of respiration. Now I'm coming on the third immediate change, postmortem change. Among the immediate changes, I'm teaching you immediate changes, postmortem changes mein. First is done. It is the earliest change, but it is not very reliable. It is the earliest, but sometimes it can mimic with suspended animation. The second, complete cessation of respiration for more than 5 minutes declares death. And third, cessation of circulation. Coming on cessation of circulation. So we have to hear with stethoscope on the precordial area. On the precordial area, we can hear the heart sound. Over the lungs, we hear the respiratory sound. And on the precordial area, a little bit on the left side, okay, we can hear the heart sound. So with this stethoscope, we have to hear both on the chest. Okay, we have to examine both on the chest. Okay, number one, on the lungs, we have to see the respiratory sound, and in the precordial area, we have to see the heart sound. So stoppage of heartbeat for more than 5 minutes, again, it's evidence of death. Okay, so here the stethoscope has to be put on precordial area. In case of respiration, it has to be put on lungs and larynx. So we have to hear the respiratory sound as well as heartbeat before declaring the person dead. Both should be stopped or ceased for more than 5 minutes. See the sign. For more than 5 minutes to declare the person dead. Don't be in hurry. You are just examining and saying there is no heartbeat, there is no respiration, the person is dead. Wait for 5 minutes. After 5 minutes, again, in the meanwhile 5 minutes, you try to resuscitate. And even after 5 minutes, it's not coming back. So you can declare the person dead. Okay, so we are done with the early changes. Can we revise? What are the three, not early, sorry, immediate changes. So what are the three immediate changes? Can we revise? You know the three immediate changes. These are the three immediate changes. Postmortem changes. Three immediate postmortem changes. Number one, insensibility and loss of voluntary power, the earliest sign, but not reliable. Number two, cessation of respiration for more than 5 minutes is evident of death. Number three, cessation of circulation for more than 5 minutes, again evident of death. These two should be confirmed with stethoscope. This on the lungs and larynx, and this on the precordial area. Okay, and this we cannot confirm. So again, I'm saying it's not a reliable sign. Okay, so let's come on the early changes now. Are you people there? Huh? Keep interacting, people. Give me some emojis, give me thumbs up so that I feel it's a live session, it's not a recorded session. Come on. So can we continue? Yes. So let's start the early changes. Immediate are done. Revise it, revise it. In my session, multiple revisions will be there. You will retain everything in the class itself. Now, next revision just before the exam. No need to revise in between. And directly you try solving your MCQs. Okay. So these are the immediate changes which are done. And now we are going to early changes. Postmortem changes, the second category, early changes. Early changes indicate cellular death. Immediate changes were indicating somatic death, and now early changes indicate cellular death. Okay, I will teach you what is somatic death, cellular death, molecular death when I will teach you the next session. Okay, death and its causes. Okay, you do attend that also. It is very interesting. So here it is indicating cellular death. For now, you learn that. So there are 6 changes. You can see the 6 changes. We are having a mnemonic also. One by one, we will take it. These 3 are very big, to understand. These 3 are very small. Quickly, we will do it. Can you see? So these are the early changes. I'm starting early. Immediate is done, and now I'm starting early changes. So first change in the early change, I'm taking changes in skin. Can I start? Changes in the skin. The changes in the skin occurs after few minutes of the death. After few minutes. I will tell you changes in the skin as well as lips. On the skin, complete skin and the lips. So changes in the skin and lips. Both we will see one by one. The skin become pale and ashy white. See the color. After death, immediately circulation stops. Since the circulation stops, the color of complete body become pale. Pale color. Okay. And ash white color. You can see pale and ash white color. And number 2, skin loses elasticity. There is no elasticity. Normally the skin is elastic. Now you can feel the elasticity in your own skin. See, the skin is elastic. Here there is no elasticity. Loss of elasticity within few minutes after that. So loss of elasticity. Elasticity is lost. You can see. So color become pale, ash white, and elasticity. You can appreciate the elasticity of the skin is lost here. You can see elasticity is lost. So that is the changes in the skin. Now coming on the changes in the lips. The skin of the lips, you can see. Lips appear dark red to black. Appreciate. The lips of a dead body. Dead person. It is dark red to black in color. Dark red to black in color. They are dry and hard due to drying of the mucosa. Okay, so these are the changes. Not really very important. See the skin changes. See the lips changes. So skin become pale and loss of elasticity, ash white. Lips become red, dark red to black in color. They are dry, they are hard because of drying of the mucosa. So these are the changes in skin which are not really very important from exam point of view. But changes in eye, make a 5-star over it. Make a 5-star over it. Changes in eye are ultra important, people. The changes in the eye after death. How many changes in the eye after death? There are 6 changes in eye after death. So let's start the big topic, ultra important topic from exam point of view. Make a 5-star, it's very important. Okay, changes in the eye. There are 6 changes in the eye. One by one, I will elaborate all of them. What are the 6 changes in the eye? So if you are examining the eye of a dead person, you should examine for the 6 things to declare it dead. Okay, these 6 things should be seen in the eye in a dead body to declare it death. Okay, so first of all, loss of corneal reflex, then opacity of cornea. These 2 things are related to cornea. Okay, then flaccidity of the complete eyeball. Okay, cornea, eyeball. Then something about the pupil. I will tell you the changes in the pupil. Then something about the retina, retinal blood vessels. And finally, the chemical changes in the vitreous humor. There are two liquids in the eye, aqueous humor in the anterior chamber, vitreous humor in the posterior chamber. I will teach you all in ophthalmology. So here chemical changes we will see in the vitreous humor. We will aspirate the vitreous humor from the eye in a dead body and we will see certain chemicals on that. To declare, I mean, we don't do all these, some of them is done, but we can do all these to confirm the death. Okay, so these are the 6 changes we will see. First, you learn these 6 changes. I'm telling you the 6 changes in the eye. So in the eye, you can make out 6 arrows and write down the 6 changes over here. So changes in the cornea, loss of corneal reflex, loss of corneal opacity. 2 things are lost in cornea. In the cornea, the reflex is lost, opacity is lost. Loss of corneal reflex, loss of corneal opacity. Learn it. 2 things are lost in the cornea. Eyeball become sunken. Eyes become sunken, going inside because intraocular tension reduced. So eye becomes sunken. Flaccidity of the eyeball. Pupils, I will tell you some changes, whether it will dilate or constrict, meiosis, mydriasis, I will tell you. Okay, and sometimes it's irregular. Retinal blood vessels, there is a very important sign, and chemical changes. So let's start one by one. Let's start with the first one, loss of corneal reflex. You see, in a dead person, if sometimes the death occurs with open eyes, sometimes the death occurs with, after death, the eyes are closed like that, you may have seen. Okay, so if the eyes are open and you are touching the cornea, there is no reflex. So loss of corneal reflex is the earliest sign seen in the eye. Earliest sign seen in the eye in a dead person. Okay, but it's not a reliable sign. Okay, loss of corneal reflex is there, but it's not a reliable sign because it is seen in many other conditions. You have to learn the differential diagnosis everywhere. You get MCQs on that. Okay, so it is seen in deep coma. Maybe this person is not dead. The person is in deep coma. It is seen in general anesthesia, not local. It is seen in general anesthesia. If the person is in general anesthesia, loss of corneal reflex. Okay. It is seen in epilepsy and narcotic poisoning. I will teach you all type of poisonings in the end. So in the narcotic poisoning, there is loss of corneal reflex. So it is not a reliable sign. It indicates death, but it's not a confirmatory sign of the death. Okay. But loss of corneal reflex occurs in death. Along with all these conditions, in death also, loss of corneal reflex occurs. And it is the first sign seen in the eye. Number one. Number two, loss of opacity. Loss of opacity of the cornea. This was loss of corneal reflex. This is loss of corneal opacity. Second thing. So coming on the second one, cornea become dry. Can you see the cornea? See, it's dry. It's dry, it's wrinkled. So drying of the cornea. Now it depends. Death is occurring how? With open eyes or with immediately after the death, the eyes are closed. Sometimes death occurs with open eyes and eye remains open for hours and hours. So cornea become dry very fast. But if the eyes are closed after the death, it delays loss of opacity from the cornea. Okay. So it is delayed if the eyelids are closed immediately after the death. Okay. Sometimes corneal opacity is lost before death in case of cholera and wasting disorder. So you should learn these differential diagnosis everywhere. Sometimes the corneal opacity is lost before death in these disorders, cholera and wasting disorder. That is the loss of opacity in the cornea. If the eyelids remain open after death, now very important sign. See, if the eyelids are open after death, so a film of cell debris and mucus get collected and it form a triangle. Okay, if the eyelids are, suppose the person is dead like this and the eyelids are not closed, they remain open for many hours. Okay, so what happens? The cellular debris and the mucus will form a triangular figure. Initially, these triangles are yellow color. You can see these triangles. Where is the base? Where is the apex? The base is towards the corneal margin and the apex is towards the canthus, medial canthus or lateral canthus. So this is the base of the triangle. Appreciate the base of the triangle and appreciate the apex of the triangle. Can you see the base and the apex of the triangle? These triangles, this is known as tache noir. What it is known as tache noir. And later on, they converted into brown to black color. Initially, they are yellow, then they convert brown to black color after 3 to 4 hours. If the eyes remain open after death, they are not closed. Okay, so what happens? The cellular debris will come and cellular debris will form a triangle over here. It will form a triangle over here. Cellular debris and mucus. These triangles are known as tache noir. You get MCQ on this. So these triangles, where is the base? Where is the apex? The base is towards the corneal margin and apex is towards the canthus, lateral and medial canthus. Appreciate it here. Can you appreciate these small triangles over here? Say yes. Can you appreciate these triangles? This is known as tache noir. You get a short note in university exam and you get MCQ over here. So that is regarding the opacity, corneal opacity. So we have seen loss of corneal reflex. It is not a reliable sign. Earliest but not reliable. Number one. Then opacity. Loss of opacity of the cornea. Okay. So if eyelids are closed, it delays. If eyelids are open, it fastens. Loss of opacity. If eyelids are open, tache noir is formed. What is tache noir? These are triangles which are formed at both ends of the eye, both canthus of the eye. Where is the apex? Where is the base? The triangles are made up of what? They are made up of cell debris and mucus. Okay, and what is the color? Initially yellow and later on black, red or black. Okay, and please see these images. You should be able to draw in your exam if it is a university exam. Otherwise, for MCQ, you should be able to identify them in image-based questions. Okay, so that is the second point we have seen. We have to see 6 things in the eye. We have already seen loss of corneal reflex. We have already seen opacity of the cornea. Not loss of opacity. Loss of shininess of the cornea, I mean. Okay, let me correct myself. Loss of shininess of the cornea is opacity of the cornea. Okay, now third is flaccidity of the eyeball. The third sign is flaccidity of the eyeball. Now eyeball is a 3-dimensional ball. It's like a 3-dimensional ball inside which there is aqueous humor, vitreous humor. Okay, so after death, intraocular tension reduces. Intraocular tension reduces. So eyeball, I don't have a ball. So size of the ball reduces. Size of the ball. Imagine a smiley wala ball, you know, ping pong ball. So the size of the ball reduces. So eyeball sunken inside the sockets, inside the eye sockets. Can you see? The eyeballs are sunken. You can see this lady. I can see the sockets over here and I can see the eyeballs are sunken inside. I can see the sockets over here and I can see the eyeballs are sunken inside. So eyeballs are sunken and soft because of the reduction of intraocular pressure. Okay, during life, the intraocular tension is 14 to 25 gram. The intraocular tension, the ball is like this. Okay, soon after death, it half. From 25, it become 12, nearly half. So the size of the ball become half. You can see immediately after death. Okay, after 30 minutes, it reduces to 3 gram only. So it's very small and it becomes nil by 2 hours. So eyeballs keep on sunking uh, after the death. So you have to learn these figures. So during life, the intraocular pressure is 25 grams. Intraocular tension is 25 grams. Immediately after that, it becomes half. 25 ka half, nearly, approx. It's 12. It's 12. And after 30 minutes, it becomes 3. And after 2 hours, it becomes 0. You can write down 0 over here. It becomes 0. So you can learn these figures for MCQs if you wish. So that is the third sign. So we are done with first, we are done with second, we are done with third. Coming on the fourth, pupil. Changes in pupil. So what happens after death? The pupils dilate or constrict? Pupil. What happens after death? Pupils dilate or constrict? Immediately after death, it dilates. But after few minutes, it constrict. It constrict. Because after few minutes, rigor mortis develops. Na? So when rigor mortis comes, it constricts. Immediately after death, the iris muscles relax. As soon as death occurs, all the muscles relaxed. But later on, rigor mortis, all the muscle contracts one by one. I mean, not in a particular sequence. So initially, since all muscles relax, iris muscle also relax, and that's by dilatation. But later on, rigor mortis, contraction of the muscle, okay, which is causing contraction of iris also, and that is causing constriction. So initially it's dilatation, you can see it's dilating, appreciate it here, it's dilating, later on it's constricted. But rigor mortis can be uneven. It is not necessary in the two eyes, right and left, it's even. So sometime in one of the eye you can get dilated, one of the eye you can get constricted. So you can appreciate uneven, unequal contraction. One of the eye is dilated, one of them is constricted. So anyway, the state of the pupil is not a good indicator of antemortem condition. It's not a good indicator. Okay, so you can see that pupil, okay, but it is not indicating any of the antemortem condition. So that is regarding the pupil. So we have seen loss of corneal reflex, opacity of the cornea, flaccidity of the eyeball, pupils. The fifth one, very important, retinal blood vessels. So within minutes after death, as soon as the death occurs, the retinal blood vessel becomes fragmented. Can you see the blood inside this blood vessel? It is fragmented. Here it is present, here it's absent. Here it's present, here it's absent. Here it's present, it's absent. This is known as fragmentation of the blood. So within few minutes, immediately after death, you can say, there is fragmentation or segmentation of the blood. They form columns in the retinal blood vessels. So suppose this is the retinal blood vessel. Imagine this is one of the retinal blood vessels. So blood is like this. So blood gets fragmented. This is known as fragmentation or segmentation. And this sign is known as Kevorkian sign. It's a very important MCQ, image-based question for your competitive exam and a short question for your university exam. Kevorkian sign, never forget. So it is fragmentation of the retinal blood vessel. Is it visible as it is? No, I cannot see the retina as it is. It needs ophthalmoscope. So it is seen by ophthalmoscope like this. You can appreciate the fragmentation over here. So it is fragmentation of the blood vessels in the retina. Fragmentation of retinal blood vessels. That is known as Kevorkian sign, seen with ophthalmoscope, not as it is. So that is the retinal blood vessel, the fifth one. The last one is the chemical changes. The sixth and the last one is the chemical changes. So we take the vitreous humor. Can you see the posterior chamber? This is the anterior chamber. This is posterior chamber. Anterior chamber contains aqueous humor. Posterior chamber contains vitreous humor. We are aspirating vitreous humor out from the dead body. We are aspirating it out and seeing the potassium concentration. So potassium concentration rises tremendously up to 100 hours after the death. It is rising, keep on rising. Okay, so potassium concentration of the vitreous humor, and it can be taken for biochemical estimation of the postmortem interval, because it is increasing. The potassium keep on increasing in the vitreous humor in a steady rate. So it can, at what interval we are taking it out, its level can indicate us the time of the death, approximate time of the death. So sometime in forensic laboratories, we can take the vitreous humor out and we can measure the potassium concentration, and it will give us the approximate time of death. Okay, so these are the chemical changes. I hope you got it. Yes or no? So these are the 6 changes in the eye. Can we revise it quickly? What are the 6 changes in the eye after death? Can you enumerate it? Yes. The first one is loss of corneal reflex, but it's earliest, but it's not reliable. It is seen in anesthesia, general anesthesia, deep coma, epilepsy, narcotic poisoning. So it is not reliable. Second, opacity of the cornea. Since the eyelid is open even after death for many hours, so the cell debris and the mucus form a triangle at the corners. The base of the triangle is towards the corneal margin, and the apex of the triangle is towards the medial canthus and lateral canthus. These triangles are known as tache noir. Initially, these triangles are yellow in color, later on convert into red and black color. So that is regarding corneal opacity. Okay, third, flaccidity of the eyeball. As soon as death occurs, the intraocular tension reduces and eyeball keep on sunking. It is sunken inside because during life the pressure is 25 gram. Immediately after death, it becomes 12 gram, and after half an hour, it becomes 3 gram, and after 2 hours, it becomes 0 gram. So eyeball sunken after death. Okay. The next is pupils. Pupils may dilate initially and then constrict later on due to rigor mortis. But rigor mortis can be uneven. So one pupil can dilate, one can constrict. This can also be the scenario. Okay. Retinal blood vessels. There is fragmentation of retinal blood vessel immediately after death, and this is known as Kevorkian sign. It is not seen as it is. It requires ophthalmoscope. And last one is chemical changes. In the vitreous humor, you see potassium rising steadily. So with the help of the concentration of potassium in the vitreous humor in a dead body, we can give approximate time of death. So these are the 6 changes in the eye in a dead body, the postmortem changes in eye. You can see the table. The same 6 changes are enumerated in the form of the table. If you want to learn like this, you learn like this. You want to learn like this, it's your choice. You want a table, the table is in front of you. Okay. So can we come on the next change? So let me revise. Where were we? We will revise. Where were we? Kahan the hum? We started our topic today. What is our topic today? Postmortem changes. Postmortem changes. We divide them into 3 portions. The first portion, immediate changes, are 3. They are already done. Okay. We have revised them. Insensibility, cessation of respiration, cessation of circulation. The mnemonic is IRC. I really collapsed. Then we started early changes, which are 6 in number, in which we have seen skin changes, the 2 types of skin changes, actually changes in skin and changes in the lip. Changes in the skin become pale, the skin become pale, it become loss of elasticity in the skin, in the lips it become dry, hard, and dark red or black in color. Then we see changes in the eye. I told you the 6 changes in the eye, they are in front of you, all 6. And now I'm starting muscle changes, which are very small here. Muscle changes. After that, these 3 are the big portions we have to cover today. The biggest portion of this session will be the next 3. Okay. So coming on the muscle changes quickly. What happens to muscles after the death? You tell me, muscles relax or contract? What happens? Give a guess. Give a guess. What happens to muscles after death? So 3 things occur. Initially relaxation, then contraction, then again relaxation. First primary relaxation, then contraction, which is known as rigor mortis. That is my last change over here, rigor mortis. And then again relax. So imagine a person is dead. As soon as the person is dead, the complete body relax. All the muscles relax. All the muscles relax. From head to toe, each and every muscle relax. Okay. After few hours, 1 to 2 hours, they start contracting. Not simultaneously, one by one, in a sequence. I will tell you the sequence of the rigor mortis. Involuntary as well as voluntary. Both muscles contract. First involuntary contract, then voluntary contract. And I will tell you a particular sequence. You have to learn that sequence. They contract. And again, after 36 hours, 24 to 36 hours, they relax. That is secondary relaxation. Okay, that is known as flaccidity after rigidity. First flaccidity, then rigidity. Then flaccidity after rigidity. Learn their other names. They are very easy. Okay. Rigor mortis also known as cadaveric rigidity. Rigor mortis also known as cadaveric rigidity. It is not cadaveric spasm. Cadaveric spasm is the differential diagnosis of rigor mortis. I will tell you what's the difference between cadaveric rigidity, that is rigor mortis, versus cadaveric spasm. I will come on that. I will tell you in the differential diagnosis. So these are the 3 muscle changes. So in the muscle, 3 things happen. First relaxation, then contraction, then again relaxation. This is known as primary relaxation. This contraction is known as rigor mortis, cadaveric rigidity, and this is known as secondary relaxation. So learn their names, learn the 3 phases. You can make arrows over here. Learn the sequence of their occurrence. So currently here, I'm telling you only first change, primary relaxation. As rigor mortis and secondary relaxation, I will tell you here. So in primary relaxation, as soon as the death occurred, primary relaxation, all the muscles of the body from head to toe, they relax. All the muscles relax. Primary flaccidity. All the muscles of the body, they get relaxed. Okay. All the voluntary as well as involuntary muscles, they relax. Okay. And it lasts for 1 to 2 hours. Because after 2 hours, the rigor mortis sets and they start contracting. So first relaxation for 1 to 2 hours. After that, rigor mortis set in. So contraction, and then again after 24 to 36 hours, they relax. So please learn the duration, which are MCQs, important MCQs. Okay. So what's the sequence? First of all, lower jaw fall. As soon as the person dies, now the lower jaw falls. Okay, because these muscles are relaxing. Lower jaw falls. Eyelids loses tension. The eyelids are losing the tension. The eyes are open only, and the eyelids loses tension. Joint flexible. All the joints become super flexible. You can move it very easily anywhere. All the joints are super flexible. Okay, body flattens to the contact area. It is known as contact flattening. Whatever is the position of the dead body at that time, body flattens in that position. Okay, so this happens in primary flaccidity. So in primary flaccidity, the complete body relax. You have to learn like this. Okay, now why the body is relaxing? Why the complete body is relaxing? Why it is not contracting? Because for relaxation, ATP. Now, as soon as a death occurs, a remnant ATP is present inside the dead body. Remnant ATP is present. Till the ATP is present, it will relax. Once the ATP is, they are utilized, there is no more ATP. The rigor mortis start. For relaxing the muscle, you know how muscle contract and how muscle relax? Physiology, you remember? There is actin, there is myosin, actin-myosin complex is formed. So for contraction, calcium is required. For relaxation, ATP is required. You are getting my point? So as soon as the person is dead, some ATPs are already present. That is causing the relaxation. Because for relaxation, ATP is required. Once the ATPs are exhausted, rigor mortis will set in. Because there is no more ATP, now muscles start contracting. Okay, you got my point. So I will tell you this again in the rigor mortis. So because as long as the ATP is there, it will break the cross bridging between actin and myosin. ATP is required for breaking the cross bridging between actin and myosin, and it causes relaxation. Okay. Although the muscles are relaxed, in primary relaxation, if you give electric stimulus, you can see the twitchings in a dead body. If you give the electric stimulus at this stage, now at this stage, if we are giving electric stimulus, twitchings are seen. It responds to electric stimulus. So it is responding to electric stimulus, mechanical stimulus. If you give mechanical stimulus, again you can see the twitchings. Paralysis is still going on inside the body. Okay, there is still paralysis, ciliary movement inside the body. You know, where is cilia in the body? They are still going on, and WBC motion still going on. So these all are going on in the primary relaxation. The muscles get relaxed, but these all things, the muscle, although they are relaxed, they respond to mechanical and electrical stimulus. If you give mechanical or electrical stimulus, you can see the twitchings in the muscles in the dead body. Okay, paralysis still going on, ciliary movement still going on, WBC motion still going on in primary flaccidity, which is for 1 hour, 1 to 2 hours. Okay, sometimes you can see the focal twitchings. Can you appreciate the twitchings? It can be horror. Okay, you imagine it's a dead body and you can see the eyelids are showing the twitchings. Appreciate this twitching. It's a video, it's a GIF. You can see the twitchings. So sometimes due to motor neuron discharge, focal twitchings are appreciated, and it can be a horror show. Okay, someone can be scared. Is it a dead body or is it a live person? Okay, or it can be a ghost. I don't know. Okay, so twitchings are seen. Pupils react to atropine and physostigmine, but there is no reaction to light. If you put light on the pupil, no reaction. But if you put atropine or physostigmine, it will show the reaction. That is the pupil. Okay, all the muscles are relaxing now. So sphincters also relax. So dead body passes feces and urine. Fecal and urinary incontinence is very common in the dead bodies. As soon as the death occurs, urinary incontinence occur in a dead body, fecal incontinence can occur in a dead body because sphincters are relaxing. Urinary sphincter, the bladder sphincter, and the anal sphincter, they relax because they are also muscles. No? All muscles are relaxing. So urine and feces evacuation is common in the dead body. So that is regarding the muscular changes I taught you. People, are you there? Are you there? Is my volume is low? Someone is saying my volume is low. So I'm having mic in front of me at the center, but I keep on moving now. So maybe some fluctuation depending on my position from the mic. But I guess it's visible. You can use a earphone for clear audio. Can we go ahead? Okay. So what we have learned till now, postmortem changes. Immediate are done, early are going on. In the early changes, we have seen changes in the skin. We have seen 6 changes in the eye. I'm sure you are able to enumerate all 6 and say some details about them, important details about them. And then we have seen muscle changes. In the muscle changes I taught you, there are 3 types of muscle changes. As soon as the death occurs, muscle relax. All the muscle relax. That is primary relaxation. After 1 to 2 hours, it is for 1 to 2 hours. They start contracting. It is rigor mortis. And Rigor mortis is there for 24 to 36 hours, and after that again relaxation. That is secondary relaxation. So currently I taught you primary relaxation. I have not taught you rigor mortis, which I will teach you here, and secondary relaxation also I will teach you here. So muscles partially I have taught you, only primary relaxation. So all the muscles relax. First the jaw, the jaw muscles will relax. After that eyelids will become loose, all the muscles will lose. The sphincters are also loose, so fecal incontinence, urinary incontinence can be there. Okay, but focal twitchings can be there. Okay, the relaxed muscle can respond to electric and mechanical stimulus. Okay, eyelids, I mean pupil is not responding to light because the iris muscles are not contracting or relaxing, but they respond to atropine and physostigmine. Okay, so they respond to the drugs, but our pupils don't respond to light. Now coming on the most important topic, these three topics are ultra important for today. Yes, so coming on cooling of the body. Algor mortis. This is rigor mortis. This is Algor mortis. Now these three are long question. People, these all are short question. They can be asked individually for the short question. They are asked for the short question. Eyes can be the long, but remaining are short question. But these three, all of them are long question for your university exam. And for MCQ, most of the MCQ, 70-80% of the MCQ from this portion. So the next half of the session is super important. Okay, till now you got the overview, but next half, these three things are ultra important. So coming on cooling of the body. Cooling of the body is known as Algor mortis. Learn its other name. It is known as Algor mortis. Okay. Now, if it is coming as a long question, you have to frame your answer under these headings. You have to describe Algor mortis or cooling of the dead body under these headings. First, you tell me the introduction. Then you tell me the heat loss mechanism. How a dead body loss heat. What are the types of heat loss mechanism you have read in your 6th or 7th standard in your school in science book? Yes or no? Conduction, convection, radiation. These are the ways how heat get transferred from one object to another. So how heat loss takes place from a dead body? Via which way? Is it conduction? Is it radiation? Is it convection? Or is it all of the above? So that we will discuss over here. Heat loss mechanism. Then the pattern of cooling. You have to draw the graph. How the cooling takes place. Okay, we will draw the graph. Then how to measure the temperature of a dead body. How to measure? What are the ways? How temperature is measured in a live person? How we will measure the temperature in a dead body? What is the approximate formula via which we can calculate the time of death measuring the temperature? Can I measure the temperature of a dead body and can I tell the approximate time of death? Yes, I can do so. Okay, so I will tell you a formula over here based on the temperature of the dead body and based on the rate of losing the temperature. I will tell you the approximate time of death. Okay, and then finally I will tell you the factors affecting rate of cooling. There are many factors that will affect the climate and the coverings over the dead body and all. So it's very interesting. But the thing is that you know my pattern. Most of the students are old students and they know my pattern of teaching. I always teach you the things in headings so that you can revise them faster, retain them faster, and in the exam you can write your answer under headings so that you get good marks and distinction. Many students got distinctions this year and I'm very happy and I'm proud of you. So the same will apply for the third prof also. Okay, so if it is coming as a long question, you learn these headings inside which you don't have to learn anything. You have to understand and recreate in the exam by your own, in your own words. But you have to learn these headings. You don't miss these headings. You have to describe your answer under these headings. Let's start it. Let's start with the introduction. Okay, with the introduction. Introduction may fall in body temperature after death. As soon as the death occurred, body temperature started falling. Body temperature started falling. That's why I'm saying cooling of the body. Cooling of the dead body, I must say. Okay, so it is known as chill of death. The other name is chill of death, or also known as Algor mortis. Algor mortis, not rigor mortis. It is Algor mortis, chill of death. The mechanism is very complex, but I will try to teach you. But the mechanism is very complex. It is not uniform. It do not follow Newton's law of cooling. You know Newton's law of cooling. This dead body do not follow because it is dead now. After that, there are no rules. Dead body do not follow any law of cooling. No Newton's law of cooling. It is very complex and haphazard mechanism, but we will try to understand. It helps us to calculate the approximate time of death. That's why it's very important. I told you now we can measure the temperature of the dead body and we can see the rate at which temperature is falling and we can calculate the approximate time the person was dead. From that, I will give you a formula for that. So that's why this is very important to measure the temperature of the dead body in medico-legal cases, not in all cases. We are talking only about medico-legal cases here, by the way. Okay, we see postmortem changes only in medico-legal cases. not in any other natural death or any other casual death. Okay, chalo. So what are the ways heat transfer takes place? In the school time we have learned there are three ways the heat transfer takes place. One is conduction, in which heat is transmitted via solids. Can you see? These are solid particles. So they are transferring heat one to another. Solid. Conduction takes place in solids. It is direct contact. Via direct contact, the heat transfer. Okay. So if it is in direct contact, then only heat is transferring. Direct contact, solid particles. This is known as conduction. I guess everyone knows that. School time. This is convection, the second way, which occurs in liquids as well as gases. Okay. It is not direct. You can see the lower molecules are heated. They come up and the upper molecules go to get heated to the below. So these waves are created. Have you tried boiling milk or water on a gas? You can see the convection. Okay. So first these molecules are heated, they come up, and the upper molecules which are cool, they go down. It is not direct contact. This is convection. It is seen in liquids as well as gases. Okay. And third, radiation. Via radiation, the heat is transmitted to the atmosphere directly. So that is radiation. So these are the three ways of heat transfer. I guess everyone know conduction, energy is transferred via direct contact. In solids, convection, energy is transmitted via motion of the molecules. Molecules are moving. Okay, it is not direct contact. It is seen in gases and liquids. And radiation. Radiation is transmission of the electromagnetic radiations to the atmosphere directly. So these are the three ways I guess everyone know. Now with this introduction, let me come on the heat loss mechanism in a dead body. Which one is working in dead body? Out of the three? All three. Suppose this is a dead body. Okay, now it is losing heat. So how it is losing heat? Via direct contact, it is losing the heat to the surface. It is losing the heat to the surface. Wherever the body is lying, it is losing the heat. So this is conduction. Via direct contact, it is losing heats to the bedding, floor, objects all around. So this is conduction, direct contact. Number one. Convection. So air is all around. Na? Air is a gas. So air is all around. So it is losing the heat to the air molecules, moving air or water currents. If the body is in water, sometimes the death occurs in drowning. So in the water or in the air, that is convection. And radiation, via radiation also the heat is lost. So all three mechanisms, the dead body is losing heat. My point is that. Okay, now as soon as the death occurs, we all know circulation stops. Yes or no? Yes, obviously. As soon as the death occurs, the circulation stops. When the circulation stops, now inside this dead body, please do understand. This is the blood vessel, for example. Okay, blood is flowing in the blood vessel. So blood transfers heat. Okay, we all are alive right now. Inside our body, we have multiple blood vessels. Blood is flowing constantly in all the blood vessels. So blood is transferring heat from here to there. That's why we have a uniform body temperature. Okay, and blood is transferring the heat from here to there. So blood flow is important for transfer of the heat. But when the person is dead, this person is dead. So here the blood stop flowing. The blood stop flowing. There is no blood flow. So convection stop. There is no convection. Okay, internal heat transport by convection stop. Normally heat transport takes place in a live body via convection. We have blood vessels. Blood vessels contain blood. Blood is a liquid. And via convection, it keeps on transferring heat from heater areas to cooler areas. And that's why we have a uniform body temperature of 37 degrees Celsius. Yes or no? But this one will stop. So you must think, ma'am, heat is not transported from here to there. So body start losing heat. But no, the mechanism is complex. You know, body generate heat first. Body generate heat by residual metabolic processes and bacterial metabolism in the intestine. So initially body is generating heat. Okay, at one end I am saying body is losing heat, at another end I am saying body is generating heat. So initial temperature is constant. You are getting my point? They are cancelling each other. So on one end I am saying the blood flow stop, and that's why internal heat transport stop. There is no convection. So you may thinking body is losing heat. Yes, body is losing heat. But on the other end, body is generating heat. So they cancel each out. Since they cancel each out, initially there is a plateau. I will show you the graph. If you appreciate the graph over here, I will show you the graph. In this graph, initially you can see there is a plateau. This plateau is that there is cancellation. On one end, body is losing heat, and on other end, body is generating heat. Okay, so initially there is a plateau. That's what I want to explain over here. Okay, initially there is a plateau. Now after some time this will stop. Heat generation will stop. Now body will start losing heat. As soon as the cooling begins, there is a temperature gradient. I mean, the heat is lost from the surface, not from the core. So there is a temperature gradient. The core is warmer and the surface is cooler. there is a temperature gradient in the dead body. When the cooling starts, the core is warmer and the surface is cooler. So there is a temperature gradient. There is a temperature gradient, and heat transfer takes place from here to here, from here to here, till the temperature becomes equivalent via conduction. There is no convection because blood is not flowing. In a dead body, it cannot be convection. It is only conduction. Via direct contact, organ to organ, organ to organ, cell to cell, cell to cell, it is losing heat. So this happens. Okay, and finally it happens till the temperature of the body become equal the temperature of the environment. Both of them become almost equal, then it stops. So this is how cooling takes place. You understood? So let me summarize what I have explained. So heat loss mechanism, initially, as soon as the dead body is there, so conduction, convection, radiation, via all mechanism, it is losing the heat. Okay. Now, as soon as the death occurs, circulation stop. Since the circulation stop, convection will stop. Convection will stop, so body start losing heat. On one hand, it is losing heat. On other hand, it is generating heat. So they cancel each out, and initially there is a play 2. Later on, generation will stop. Only losing is there. Now losing is more on the surface as compared to core. So there is a temperature gradient between the surface and core. So from the core, the heat comes to the surface and keep on losing to the environment via conduction, not convection, till it becomes equivalent to the environment. How many of you got it? It was complex, but I tried with the help of flowcharts, the complete story. Give me a thumbs up, everyone. Say, got it? So this is how the heat loss takes place in a dead body. You have to write down all the flowcharts. Initially, why there is a play 2? You have to explain. The two things are cancelling each other. You should explain. Convection stop. You should be able to explain that. Okay, and later on, what is happening? How temperature gradient created between the core and the surface. The body is losing heat from the surface, not from the core. So core is hotter, but the surface is warmer. So there is a temperature gradient, and based on which we will calculate the approximate time of death. I will come on that formula. Okay, now coming on the graph. Pattern of cooling. I will come on the graph. Okay, now what happens? How to draw this graph? So initially, in the half to 1 hour, temperature is same. It is play 2, 37 degrees Celsius. Normal human body temperature, it is known as isothermic phase. Or it is known as play 2. Appreciate this play 2. Isothermic phase. You know the reason. On one hand, body is losing heat. On other hand, body is generating heat. Both things cancel each out. So initially, half hour to 1 hour, you can say. You can see the time, half hour to 1 hour. Appreciate, on x-axis we have time, and on y-axis we have the temperature. And this temperature is 37 degrees. You should be able to draw it in your exam. People, I will draw it for you. So draw here, write down 37 degrees Celsius. So initially for 1 hour, it's constant. It is known as isothermic phase. Later on, there is linear cooling rate. What is the rate of falling? What is the rate of falling the temperature? 0.4 to 0.6 degrees Celsius. What is normal temperature? 37 degrees Celsius. In 1 hour, 37 minus 0.6. In the second hour, whatever is the answer, minus 0.6. In the third hour, whatever is the answer, minus 0.6. You can do the calculations. So 0.4 to 0.6 degrees Celsius per hour for the next 12 to 16 hours. You can see fall. 0.4 to 0.6 degrees Celsius per hour for the next 12 to 24 hours. You can see. Okay, so this will happen. And finally, it will slope uniform because the temperature of the dead body is nearly equivalent to the atmosphere, to the environment. Then again it becomes constant. So this is the complete rate. You should be able to draw this graph. It is starting from 37 degree, falling and becoming equivalent to the temperature. I don't know the temperature of the atmosphere. Maybe it is a summer season, maybe it is a winter season, maybe it is a rainy season, spring season, maybe it is a tropical country, maybe it is a temperate country zone. I don't know. So depending from region to region, season to season, climate to climate, the temperature of the atmosphere will differ. Death occurs in all seasons, of course. Okay. So it will occur till the temperature of the dead body become almost equivalent to the environment. Then again a play 2 is coming. So you should be able to draw this graph. Other two graphs I will tell you later on when I will teach you lividity and decomposition and all. Currently you focus on this one graph. That is cooling graph. Algor mortis graph. So you should be able to draw that. So please see. So tell me the graph. Say initially half to 1 hour. It's isothermic phase or play 2 phase in which temperature is same, and tell the reason for that. On one hand, body is losing temperature. On other hand, body is generating the heat. You know the reason of generation, and they cancel each other. For half to 1 hour. After that, there is a linear fall. What is the rate of this fall? Say 0.4 to 0.6 degrees Celsius per hour for the next 12 to 24 hours. next 12 to 24 hour, see 24 hour, and after that it becomes constant when it becomes equivalent to the environment. I'm giving a big range, I don't know the environment. Okay, cooling occurs fast in winters, cooling occurs slow in summers. Obviously you can understand this physics, yes or no? So that is the graph. I hope you got it. Now, how to measure the temperature of a dead body? How to measure the temperature of a dead body? How we measure the temperature of a living body in a living person? I mean, we can keep the thermometer below the tongue, okay, or we can keep the thermometer in the axilla. Okay, what are the ways of measuring the temperature in a dead body? First of all, we need a long thermometer. A 25-meter long thermometer, a laboratory thermometer is needed, and we can take the temperature at the three sides. Usually the best is to take the rectal temperature. We can take the rectal temperature of the dead body, okay, to see the temperature, actual temperature, because rectal temperature will give the core body temperature, rectal temperature, okay, except in case of sodomy. I will teach you sodomy in sexual assault, okay, sexual cases. So in case of sodomy, we don't put the rectal thermometer. Otherwise, in all other cases, we can take the rectal temperature, or else we can take the temperature from the liver surface. How to take the temperature from the liver peritoneal surface? A small incision is given and insert the thermometer. A small incision is given over here and insert the thermometer and take the temperature from the peritoneal surface of the liver. That is the second way. And third is external auditory meatus or nasal passage. External auditory meatus. External auditory meatus or nasal passage. So these are the three ways via which we can take the temperature in a dead body with a 25 centimeter long thermometer. So this is how we take the temperature. Now tell me the formula. With all this, why we are doing all this? You say, ma'am, why to take the temperature of a dead body? Come on, ma'am. What clue it is giving? By doing all this thing, I can come to know the time of death, approximate time of death with the help of a formula. I'm having a formula. What is the formula? This is the formula. This is the formula. Time since death. This is the formula. What is the numerator? What is the denominator? Appreciate the numerator and denominator. The numerator is normal body temperature. That is 37 degrees Celsius. Normal body temperature minus rectal temperature. I told you, rectal temperature is the best temperature. You measure rectal temperature of the dead body. Okay, so 37 degrees Celsius minus whatever temperature you are measuring right now. So rectal temperature will depend the time you are measuring the temperature. Because at what phase you are measuring, I don't know. So suppose I'm a forensic expert, I'm at the scene of crime and there is a dead body. It's a medico-legal case, okay, and the police want to know the approximate time of death. So at what time I'm measuring the rectal temperature? Maybe it is this time. We don't know, So we will measure the rectal temperature. And we will subtract it from 37 degrees. So 37 degrees Celsius minus rectal temperature upon rate of temperature fall per hour. Okay, so what is the rate of temperature fall per hour? I told you it's 0.4 to 0.6 degrees Celsius per hour. So exact what is the rate of fall in this particular dead body which I found at the scene of crime, at the crime scene. So I have to take multiple readings. I must take multiple readings every 1 to 2 hours to know this rate. Is it 0.4 or 0.5 or 0.6? I have to be precise. I cannot take approximately 0.4 ले लो 0.6 क्या फर्क पड़ता है? No फर्क पड़ता है. Okay, it may decide the criminal. It may help the police and the judge to take the decision, to do the justice. Okay, so we will take multiple readings in the dead body. Suppose this is a dead body in front of me. Okay, at the crime scene, and the police want to know the approximate time of death of this dead body at the crime scene, and I am the forensic expert which is called at this crime scene. Okay, so we will take the body to the forensic laboratory, and what we will do, we will measure the rectal temperature of this dead body multiple times, 1 hour, every 1 hour, every 2 hours. So we will come to know the rate of fall. Is it 0.4 degree, 0.6 degree, 0.5 degree Celsius per hour? How much it is falling? So this rate, and when I found the dead body, at that time, what is the rectal temperature? The first rectal temperature. I will put these readings over here and I will get the approximate time. So please learn this formula. Everyone got this formula? You learned this formula? Normal body temperature minus rectal temperature upon rate of fall. Say the formula, learn the formula, with the help of which you can see the time since death. You can see nowadays many series, many on the, television, you can see many series now on which all these things are shown, how forensic expert tells the approximate time of death. In many movies also it's shown. CID to sabne dekha hoga bachpan mein, yes or no? So this is how actually they calculate. So this is the formula you have to learn, and it's very important for scene of crime. Okay, So yeah, but the most important thing you must ask me over here, ki ma'am, is it not necessary that at the time of the death, the person is having normal body temperature? Normal body temperature is 37 degrees Celsius. This question should come in your mind. Ki ma'am, what if at the time of the death, the person is not having this temperature? The person is having more temperature or less temperature. And that time, this formula is not applicable. This formula will not be applicable. So body temperature may not always be normal at the time of the death. You are getting my point? So body temperature is high in embolism. If the death is due to embolism, in case of septicemia, patient have high grade fever. In case of heat stroke, in case of pontine hemorrhage, brain hemorrhage, pontine hemorrhage, in case of thyrotoxicosis, stress, drug reaction, carbon monoxide poisoning, heroin poisoning, cocaine poisoning, in all of them, there is high grade 104, 105 not. So there is high grade temperature. You're getting my point? And the temperature can be low in case of collapse, okay, hypothermia, hypothyroidism, cholera, shock. You're getting it. Because here blood flow will be less, so temperature will be less. So this formula will not be applicable in such cases. We are talking about this formula when at the time of the death, the person is having normal body temperature. Are you getting my point? So all these things you have to take in consideration being a forensic expert. Okay, becoming a forensic expert is not at all an easy job. Getting my point? Now coming on the last thing, factors affecting rate of cooling. We have already seen the formula, and finally I'm telling you the factors which affect the rate of cooling. So how many factors? We are having 5 factors which affect rate of cooling. What are these 5 factors? Number 1, temperature difference between the dead body and the environment. Dead body and environment. What is the temperature difference between the dead body and the environment? So in tropics, in temperate, tropic climate, temperate climate. In tropic climate, the rate of cooling is 0.4 to 0.6 degrees Celsius per hour. I told you in India it's like this. But in temperate climate, it can be 1 degree Celsius per hour. It can be as high as that. Okay, so if you get the dead body and if you are a forensic expert, measure the temperature, maybe rectal, maybe liver, maybe internal auditory canal. Whatever temperature you are measuring, measure that temperature multiple times to come to know the exact rate of cooling. Okay, so it depends on the temperature difference between the dead body and the environment. The external environment is cool or warm or hot. Depending on that, the heat loss will be there. Common physics. Okay. Second, build of the cadaver. Build of the cadaver. Cadaver is a child or an old or adult. Now, simple formula is that cooling rate is directly proportional to weight upon surface area. Cooling rate is directly proportional to weight upon surface area. Okay. So weight upon surface area is high in children and adult. Weight upon surface area as compared to adult. So cooling is faster in children and adult. Children and old as compared to adult. So in adult, cooling is slow, but in children and old, cooling is fast. Cooling is fast. I'm talking about the dead body. Suppose there is a dead body of a child, adult, and old. Okay, there are many factors, but one of the factors is build of the cadaver. It is weight upon surface area. Weight upon surface area will be high in children and old age. So cooling is faster, and that will be low in adult. That's why cooling is lower. The third is the physics. Okay. Now whether there is an obese person or a lean person, there is a dead body of an obese person or a lean person. In obese person, it cools slowly because there is much of the subcutaneous fat that will act as the thermal insulator. Okay. So core temperature cannot be lost in the environment because lots of fat around the body, which will act as like an insulator. Common sense. Okay, that's why it will cool slower. Lean body don't have much fat. Subcutaneous fat is less, so it will cool very faster. So if there are dead bodies of an obese person and a lean person, so obese will cool slowly and the lean will cool fast. You can understand. It depends on the subcutaneous fat. I hope you got it. That is the physics. The next is the environment. Okay, now environment. If the dead body is kept in a ventilated room, suppose the dead body is kept in a ventilated room, so cooling is faster. And if it is kept in a packed room, cooling will be a little bit slower. Okay. And what about the body immersed in water? Suppose there is a dead body, in case of drowning, it is immersed in water for 2-3 days, 1-2 days. Sometimes it happens. Maybe it's a suicide, maybe it's a homicide, maybe it's a murder, maybe it is killed on the land and then thrown in the water. We don't know. That's what we want to know here. Yes or no? So what about the cooling of the body in water? So if the cooling in water is always fast as compared to cooling in air. In water, it's always fast, obviously. In still water, cooling rate is double. In flowing water, it's triple. But in sewage water, sometimes the dead bodies are thrown in sewage, drainage and sewage sometimes. So it is slower because of the organic matter. Sewage contains the feces, the organic matter, no? So cooling is slower. So still water, flowing water, it is faster. But in sewage water, it is slower. The reason for slow cooling in sewage water is organic matter. Okay. I hope you're getting all these points for your MCQs. Don't try to mug it up everything. Whatever you are remembering, you write down in your university exam, you will get distinction. Take my words. Take my words. Okay. For MCQ, you don't try to mug it up. Looking at the options of the MCQ, you will realize the correct answer. The beauty of the MCQ, the 4 options are in front of your eyes. It's not fill in the blanks. It's MCQs. The 4 options are in front of your eyes. Only thing, your eyes must be able to pick the correct one. And by listening my lecture at least once, you should be able to do so. So don't try to mug up and take so much stress. Ma'am, there are so many points in forensic. It's okay. Whatever you are remembering, you write down in university exam. So distinction pakka. And in MCQ, I guarantee you will be able to solve all the MCQs. Okay, even if you are listening the lecture once with attention. And last thing here is the coverings of the body. The dead body is covered in blanket or simple clothes are there. If it is covered in blanket will give the insulation. So slow cooling will be slow. But if it is simple bed sheet, simple clothes, so cooling will be faster, common sense. So these are the factors which affect cooling. What are the 5 factors? External temperature, depending what is temperate climate and tropic climate. Okay, the second is build of the cadaver. It is fast in children and old, and it is slow in adult. Okay, it is fast in lean, it is slow in obese. Okay, it is fast in a ventilated room as compared to packed room. It is fast in water as compared to air, but in sewage water it's slow. Okay, and depending on the covering, is it a blanket or simple bed sheet, the dead body is covered in. So common sense, these are the factors which affect the cooling. So if it is coming as a long question, will you be able to write down? Say yes. Will you be able to write down? Yes. So we will revise it. We are done with Algor mortis. I will come on the next topic. Before that, you people help me in revising. Say, you people. So Algor mortis. If you are getting a long question on Algor mortis, you are going to describe your answer under these headings. People, give me a thumbs up. Come on. Chalo. So in the introduction, what's you are going to write? In the introduction, write down it is known as Algor mortis. Okay. And it's a complex mechanism. It do not follow Newton's law of cooling. In the introduction, you can write down these points. Heat loss mechanism. Dead body loses heat by all 3 mechanisms: conduction, convection, and radiation. Okay, but you have to explain it. As soon as the death occurs, convection inside the body will stop. There is no convection because blood flow stops, circulation stops. There is no convection. Okay, now on one side, body lose heat, and on other side, body generate heat because of residual metabolism and the intestinal bacteria, they generate heat. So they cancel each out. And initial phase is isothermic phase or Plato phase. Initial for half to 1 hour. Half to 1 hour. After that, body only loses heat. It don't generate. Generation will stop. It don't generate. Only lose. It keep on losing heat. Okay. And it will keep on losing till the temperature of the dead body become almost equivalent to the environment temperature. Okay. So if you want to draw the graph over here, the pattern of the cooling, we will draw the graph. Graph has x-axis, y-axis. On y-axis, we will take the temperature, 37 degrees Celsius, the normal human temperature. And here we will take the time, half hour, okay, half hour, 1 hour, 2 hour, 3 hour, like that. Okay, we will take the time. So initially for half to 1 hour, it's Plato. After that, it falls uniformly at a rate of 0.4 to 0.6 degrees Celsius per hour till it becomes equivalent to the environment and again become Plato. So you should be able to draw this graph in your exam with clarity. That is pattern of cooling, the 3 phases on the graph. You should be able to show. Then how to measure the temperature of the dead body? There are 3 ways to measure the temperature. We can measure rectal temperature. Okay. We can measure the liver temperature. We have to give a small incision over the right quadrant of the abdomen. And we should take the intraperitoneal surface liver temperature and internal auditory canal. The thermometer is put in the ear. The temperature of the internal auditory. These are the 3 ways to give the temperature of the core body temperature. Okay, so this is how we measure it. Approximate formula. Who will help me? What is the formula? So approximate time of death is equal to, what's numerator, what's denominator? Numerator is normal temperature, that is 37 degrees. Normal temperature minus rectal temperature of the dead body. Normal temperature is 37 degree Celsius minus whatever is the rectal temperature you are measuring it here upon rate of cooling. Rate of cooling, don't take always this. You measure the exact rate of cooling by taking multiple readings of the dead body. Okay. Now factors affecting cooling. I told you the 5 factors you described them. We are done. People, we are done. With the long question, we are done. Can we come on the next topic? People show some interest. Come on. Huh? The chat box is still. Give me an emoji. Give me a thumbs up. Huh? Whatever is it. Okay. Yes, absolutely right. Yes. Can we go ahead? So can I come on the next big topic? Postmortem lividity. Postmortem lividity. So we are studying the early changes. Early postmortem changes. Immediate are done and we are doing early postmortem changes in which the first 4 are done and I'm coming on the 5th one. The 5th one is postmortem lividity. Again, it's a long question. I told you, these 3 are ultra important. Okay, and these 3 are also ultra important. So out of the 12, 6 are super duper important. The remaining 6 are also good, but not very important. Yeah, eyes is also important. So these 7 are very important. The others are okay. Okay, chalo. So we will come on postmortem lividity. Can I start postmortem lividity? You can see. If it is coming as a long question in my university exam, if I'm a third prof student or final year student, wherever your forensic lies. Okay. So I would like to write my answer under these headings. Appreciate the headings. So I always teach you in headings so that it retain in your mind. See the pattern. You have to learn these headings. That's it. You don't have to learn what you have to write inside the headings. That you have to understand and create your own language, own words. Again and again, I say the same thing. It's a thing. You have to understand how to study. What to study, you have multiple sources. You study from me, you don't study from me, doesn't matter. You study from any platform, any source, doesn't matter. Everyone is good. The source are different, but everyone is good. The content is same. Only the pattern differs. Got it? So whatever frequency matches with you, you should follow that source, that platform. Okay. But the point is that how to study now, you should understand that. From whatever source you are following, you should learn the headings under which you should describe your answer. Okay. What to write inside, you shouldn't learn that. Okay, you do reverse. What to write inside, you try to mug it up and you can't do so. And you don't know the heading, so you mess up in your university exam and you don't get good marks. You are getting my point? So learn these headings under which you have to write your answer. Okay, chalo. So if you're preparing for your prof exam, if you have already cleared your prof exam and you are watching my session for your competitive NEET PG INICT, don't even learn the headings. Just listen me attentively. Take my words, 100% hit rate will be there in the MCQs from this topic, whatever I'm teaching you. Chalo. Postmortem lividity. So you have to write your answer under these headings. It is also known as what. There are multiple names of postmortem lividity. Then tell me the definition, mechanism, intensity, development. First it will develop, then it will progress, then it will shift. First it will develop, then progress, then shift, then its extent, its distribution, then it fix finally. After shifting, it will fix. It is absent in what cases? Sometimes it happens in internal organs also. Color changes and medico-legal importance. So these are the headings under which we are going to study. Okay, let's start with the first one. Postmortem lividity. It is also known as, what it is known as? It is also known as hypostasis. It is known as Livor mortis, not rigor. Okay, so I told you 3 mortis. This is Algor mortis, this is Livor mortis, and this is Rigor mortis. So understand the 3 mortis. They are different. Algor mortis is cooling of body. Okay, Livor mortis is staining of the body. And rigor mortis is contraction of the dead body after initial relaxation. Okay, all 3 terms are different. Okay, chalo. So it is also known as hypostasis, Livor mortis, cadaveric lividity, okay, postmortem staining, subcutaneous hypostasis, and darkening of death. Darkening of that death. You can see the dead body stains at various areas. I will tell you which areas. So staining of the dead body is this. It is hypostasis. What I'm teaching you right now, postmortem lividity, also known as hypostasis, Livor mortis. So you get your long question on any of them. You should be able to identify they all are synonym. They all are synonym. Okay. So what is the definition? It is also known as, you learned, Livor mortis, cadaveric lividity, postmortem staining, darkening after death. Okay. Now what is the definition? What happens after death? As soon as the death occurs, capillaries and the veins distend. Arteries have a thick wall. Arteries don't distend because they have a thick wall. Oh, obviously, you have learned this in pathology, physiology. Capillaries and veins have thin wall. They get distended. Okay, because all the muscles are relaxing initially. So the muscles of the capillaries and the muscles of the veins also relax. So they get distended. Once they get distended, there is bluish purple bluish purple discoloration of the skin. Can you see the bluish purple? Say the word. Which color? Bluish purple or purplish red, whatever you say. Either say bluish purple or purplish red. You have to be specific in color. Bluish purple color or purplish red color. Okay. It is seen on the dependent parts. Highlight the word dependent. Dependent areas of the body. Why it is dependent, I will tell you. Because gravity is always there. Whether we realize or we don't realize. Newton told us gravity always works. At every moment, at every second, gravity is working. So that's why it is the dependent portion. I will explain. And this is known as postmortem lividity. So don't try to mug up the definition. So say, try to create it. After death, what happens? After death, the capillaries and veins distend. Okay, and which gives the bluish purple or purplish red discoloration on the dependent areas of the body. And that is known as postmortem lividity. Got it? Now, why it is the dependent areas? You will understand here. In pathology, have you read pathology from me? Yes or no? If you have read it, you may be knowing this diagram. Yes. So what is this diagram? In human body, in all the blood vessels, the blood flows axially. This is known as axial blood flow. What do you mean by axial blood flow? What do you mean by? So this is the blood vessel. The blood flows at the center of the blood vessel. In the periphery, there is plasma. Appreciate, this is all plasma. This is all plasma. The blood is traveling at the center. RBC, WBC, and platelets, all of them, all the cells are traveling at the center. Okay, it is Bernoulli's theorem, you know. So the heaviest portion of the fluid is at the center and the lightest portion of the fluid is at the periphery. Have you read Bernoulli's theorem in physics in your school time? So that is what applicable over here, and this is known as axial blood flow. So normally in all of us, you, me, unless until it is not inflammation, okay, we don't have inflammation anywhere, the blood flow is axial. The blood flow is like this. Okay, now whenever the body is dead, blood keep on flowing, it never stops. There is no stasis unless and until there is some disease or stasis, inflammation. So blood keep on flowing, but whenever the person is dead, okay, blood stop flowing. There is no blood flow. When the blood stop, imagine the blood stop, gravity will attract it. Gravity will attract it. Okay, gravity works all the time, and because of the gravity, everything will fall on the dependent area. Now, depending the dead body is in prone position, supine position, lateral position, you know, in which position the dead body is. The dead body is hanging, the dead body is inverse. Okay, depending, I will tell you all the conditions. So whatever is the dependent area, blood will come on that area because of the gravity. So this is how you should be able to explain. So after death, circulation stop. Obviously, as soon as the death occurs, this circulation stop. Blood becomes stagnant. Blood flow will stop. Blood flow will stop. It will sink by the gravity. You can see it will sink by the gravity. The gravity will attract it. All will fall down, and it will accumulate. It will accumulate. Okay, in the dependent areas, and on the dependent areas, there is bluish purple discoloration. I hope everyone got it. Give me a thumbs up. You got the mechanism? Huh? You got the mechanism? This is known as postmortem lividity, and this leads to postmortem lividity. Appreciate. Now this body is supine. This body is supine. That's why I can see postmortem lividity over here, over here, over here on the dependent areas. We are getting my point. So what is the intensity? Is it light blue color or dark blue color? It depends how much reduced hemoglobin the person is having at the time of the death. So this reduced hemoglobin is giving the color. So all of them are falling. RBCs are also falling. WBCs are also falling. Platelets are also falling because of the gravity. But here, who is giving the color? The color is given by the reduced hemoglobin present inside the RBC. So how much amount the reduced hemoglobin present in the RBC, that is giving the intensity of the color. If large amount of reduced hemoglobin present before death, so postmortem lividity will be very intense, dark blue, purple, red color, like that. And if reduced hemoglobin is less, it will be slight color, I mean faint purple or blue color. Got it? Now coming on the development. Okay, it depends on the reduced hemoglobin. You learn that. You learn the mechanism. The mechanism is the gravity. Gravity. After death, blood flow stop, circulation stop. So gravity will attract the blood cells. So RBC, WBC, platelet, they all will fall, and that will give the bluish discoloration. The reduced hemoglobin in the RBC. I hope to be very precise. You got it. Intensity, you got it. Development. It develops soon after death. But within 1 hour, in normal case, up to 1 hour, it's not visible. It starts, but it not visible up to 1 hour. In anemia, up to 4 hours, it's not visible because anemia have less hemoglobin. Na? Suppose this person is anemic. This person is anemic, so very less hemoglobin. Okay, so up to 4 hours, it will not be visible. Normally, up to 1 hour, it is not visible. After 1 hour, it starts appearing. Okay, after 1 hour, it appears as dull red patches. then the patches coalesce with each other and form the big areas. So this is the development. This is the development. This is like this. Now this body is prone. That's why the dependent area is the chest. Okay. The body is supine. So dependent areas will be the back, buttocks. I will show you. Okay. The position to position it will differ. Now progression. Within 4 hours, it is well developed. Maximum in 12 hours. And it persists until putrefaction set in. Okay. So it is start after 1 hour, well developed in 4 hours, start in 1 hour, well developed in 4 hours, maximum in 12 hours, and persist till putrefaction. Learn like this. Start after 1 hour. I mean start visible after 1 hour. Okay. 4 hour may well developed, but not maximum. 12 hour may peak maximum, and it remain there till putrefaction set in. Okay. And it blanches. Yes, I forgot to write here. It blanches on pressure. If we are giving the pressure, you can appreciate the blanching. You can appreciate the blanching. Okay. Appreciate. Okay. This area, why this area is not showing the lividity? This area is in contact with the surface. Maybe the person is supine at the time of the death. After death, I mean dead body is supine. So this area is in contact with the surface. Okay. So remaining area it is showing. This area, the contact area, don't show it. It is compressed now with the surface like this. I will show you the images. Okay. It is more visible in fair people. Obviously, on the fair people, on the fair skin, it's more visible. It is almost absent in anemic person. So you should know in fair people, it's more visible. In anemic, it's almost absent. Color intensity, is it bluish, purplish, or reddish? The intensity of that color depends on the reduced hemoglobin at the time of the death. So learn all these pointers, people, and learn the headings. Now, shifting of lividity. Can lividity be shifted if the dead body position is changed after death? Suppose initially dead body lies supine, and after that it becomes left lateral, left decubitus, right decubitus, or prone position. So lividity will shift if the body is moved within few hours. Okay, if the body is moved within few hours, so original patches will disappear. Initially, suppose it is supine, so lividity is on these areas, buttock, back. Then it is prone, suppose, so it will be on the face, chest, like that. It will shift because gravity will work like that now. So gravity work on the dependent area. So original patches will disappear and new patches will form, and this is known as secondary lividity, and that can confuse the forensic expert. What was the position of the dead body at the time of the death? In the crime scene, everything is important. Okay, so ultimate purpose, visiting a crime scene, forensic expert want to answer two things. Okay, how death occur, number one, and how long does it take? How much is the time, approximate time of the death? These two answers I told you in my first slide. Okay, so if the position of the dead body is changed within few hours of the death, the lividity will shift, and it can confuse the forensic expert. No? So forensic expert will consider the secondary lividity that is not showing the original position of the body at the time of the death, because it is changed. Okay, based on which we can presume that this is the original position of the body at the time of the death. Okay, so this is regarding the shifting of lividity. Lividity can be shifted unless until it is not fixed. So I told you after 1 hour it start visible. In 4 hours it is well established. Okay, in 12 hours it become maximum and it remain there till putrefaction. Okay, but if the body is shifted in the initial hours, it will shift its position. Okay, that is shifting of the lividity. Please understand all these points. Now, extent of lividity. Extent of lividity. How much area it will cover? What is the extent? We have seen the intensity, but now I'm talking about the extent. Intensity depends on reduced hemoglobin concentration at the time of the death. Extent depends on two things. Number one, how much blood the person is having. How much blood volume? More blood volume, more hemoglobin, and more extent. Okay, how much blood volume the person is having at the time of the death. Okay, maybe person not in shock. In case of shock, hemorrhagic shock, maybe less blood volumes or less lividity. You got my point? And duration, the blood remains fluid after death. Duration for which the blood remains fluid after death. Blood coagulates after death, no? So after the coagulation, lividity don't appears. So on these two factors, the volume of the blood and the duration for which the blood remains fluid, the extent of lividity depends. Okay, I hope you got it. Now, the most important thing, whether you learn all these things or not, just a second. Let me save the annotations, just a second. I'm sorry. Whether you learn all these things or not, it's your choice. It's not very important. But the most important thing in postmortem lividity is the distribution depending on the position of the dead body. So there are 6 different conditions. Whether the dead body is supine, where is the lividity? When the dead body is prone, where is the lividity? The dead body is lateral, where is the lividity? Dead body is the head down condition, like this. The head is hanging. Okay, what is the lividity? In case of hanging, what is the lividity? In case of droning, where is the lividity? Okay, so it will give clues to the forensic expert to decide the cause of the death. Got it? So we will discuss one by one with the images. So coming on first, supine position. In supine position, can you see the dead body is supine? At the time of the death, the person is supine. So dead body is there in this position from last many years. So where is the lividity? The lividity will be all these in a supine position. So where it is? It is in the neck, back, flanks, and side of the neck. You can see it is at the neck, it is at the back, it is at the flanks and the side of the neck. The dependent areas. Learn one rule. The lividity will be on the dependent areas. You can see, appreciate the lividity. It will be not there on the areas which are in contact with the surface. You can see this area is in contact with the surface. So lividity will not be there in contact area. The remaining area, the pressure area, lividity will not be there. Okay. But other dependent areas, lividity will be there. Appreciate the bluish, purplish, reddish color. Appreciate the intensity. Appreciate the distribution. You know the factor which decide intensity. You know the factor which decide distribution. Got it? So pressure areas like the occiput, buttocks, and thigh are pale. They don't show lividity. Occiput, appreciate the buttocks. Buttocks are always pressure area when the person lie down supine. So buttocks are always the pressure area. On buttocks there is no lividity. Okay. On the occiput there is no lividity. Occiput is not shown here. This area. Occiput there is no lividity. So on the pressure areas it is pale. Okay. Sometimes if the tight clothings are there at the point of the elastic or tight clothing is there, that area remain pale. Okay, so that is the supine. I guess everyone got it. Coming on the prone. If the dead body is prone, if the dead body is, so what is the dependent area now? The dependent area is the face and chest. Face, chest, and front of the limbs. Front of the limbs, not back of the limbs. So this will be the lividity. So since the complete blood is stagnant on the face, so sometimes nasal bleeding occurs. Okay, from the dead body. Appreciate in this case. Nasal bleeding can occur. Okay, so nasal bleeding is very common in this position, that is prone position. Coming on lateral, can you see the dead body is lateral? In this case, lividity occurs only on one side, depending in which side. Is it right lateral or left lateral? Right decubitus or left decubitus? So only on one side the staining occurs, lividity occurs, not on the other side. So depending on the staining, we come on a conclusion what was the position of the body at the time of the death, at the crime scene. You are getting my point? It is giving a big clue. So appreciate in supine position, in prone position, in lateral position. Tell me the areas of the lividity. I have shown you the images. In supine position, say its neck, its back, and its thigh. Okay. In prone position, its face, its chest, and its upper area of the limbs. Okay. In lateral decubitus position, it is only on one side, whether right or left. So you should be able to draw these images and explain. After that, coming on the fourth, head down. Sometimes the head is hanging. Suppose someone is lying on a bed and the edge of the bed, suppose this is a bed. Okay. And dead body is here like this. Okay. The head of the dead body is hanging like this. Okay. Don't laugh at the images. I'm trying just to explain you the hanging head. So the head is hanging. The head and the neck are hanging like this. In that case, the complete lividity in the face. Okay, face and neck. Deep congested. Looking like suffocation. It may mimic suffocation. Okay, it can be seen in drunkards. Okay, the person is drunken and died like this. Or in case of epilepsy, like that. Okay, hanging. What about hanging? Where will be the lividity? What is the dependent area? It will be legs. It will be genitalia. Legs and genitalia. So it will be the legs, hands and genitalia. Legs, hands, and genitalia. You can appreciate the dependent area very easily with the image. So appreciate the legs, appreciate the hands and the genitalia. So that is in case of hanging. What about drowning? Where is the lividity in case of drowning? Huh? If the body is constantly moving, there is no lividity. If the body is constantly moving, so position of the body keep on changing depending on the flow of the water. So gravity cannot act it. So there is no lividity. Lividity will be absent. But if the body is there in the border, stationary, I mean not moving. So it can be on the face, chest, hands, feet, and the calves. Dependent in the water, depending what is the position of the body in the water. So that is in case of drowning. Okay, drowning is not very specific, I mean. So these are the positions and you should be able to draw the diagrams and explain the position of the lividity. Okay, I hope you got the distribution of lividity. Yes or no? Will you be able to explain all of them? Will you be able to explain all of them? My voice is not clear. Is it that? Kindly give a genuine review. My voice is clear to all, or it is not clear only to some students. You can write down in the comment box. So I can work up on the mic or something like that. I guess my mic is very close to me. Let's try now. My mic will be in the screen. It's okay, but let me make it more closer. Now, is it audible? Now is it audible? Okay, the mic will be in the scene. It's okay. Chalo. So if it is audible now, let's go ahead. Is it clear? Chalo, let's go ahead. The students who are finding difficulty in voice, why don't you use earphone? It will be clear in that case. Let's try. I mean, you can try like that. So chalo, can we revise the distribution of the postmortem lividity in all these cases one by one? Can we revise together? Chalo. In supine position, where it is on the neck, back, and it is on the back of the thigh. Where it will be in prone position, it is on the face, chest, and upper part, superior part of the limbs. In the lateral position, it is only on one side of the body, whether right or left. In the head down position, it will be on the face. It will mimic suffocation. Okay. In the hanging, it will be on the hands. It will be on the legs and genitalia. Okay. In case of drowning, it can be anywhere, but if the body is moving constantly, there will be no lividity. I hope I'm crystal clear in that. Can we go ahead? Can we go ahead? Now, fixation of the lividity. Let's come on the next topic, fixation of the lividity. Okay. Now lividity get fixed after 12 hours. After 12 hours. After 12 hours, what happens now? The blood vessels rupture. The blood come out and blood will deposit in that area. See, blood vessel will rupture. Now, if the blood vessel is rupturing, blood will deposit here. No, it will not shift, even on changing the position of the body. So if the dead body position is changed within 12 hours, the lividity will change and secondary lividity will develop. But after 12 hours, once the blood vessels are ruptured and lividity develop here, even on changing the position of the dead body, it will not change, and it is known as fixing of the lividity. So lividity becomes fixed after 12 hours because of breakdown of the blood vessel, hemolysis, blood comes out, and blood spread in the soft tissue. Blood spread in the soft tissue. I hope you got it. This is known as fixing of lividity. Lividity is absent in two cases. Whether the person is severe anemic, hemoglobin hi nahi hai, there is no reduced hemoglobin, severe anemia, or whenever there is severe blood loss before the death. Example, accident, surgery, okay, any case, severe blood loss, more than 65% of the blood loss. So either there is severe anemia or severe blood loss. In these two cases, after death, there is no lividity. No lividity. So lividity is giving many clues to the forensic expert and helping the forensic expert to come on the conclusion on the cause of the death and the approximate time of the death. You are getting my point? It's very important. Lividity occurs only on external skin. It occurs on internal organs also. Okay, the dependent internal organs. So dependent part of the internal organs also show lividity. We can see it externally only, but if we do perform the autopsy, we can see internal lividity also in the organs. Okay. So in case of supine position, it will be on the cerebrum or cerebellum. Suppose the dead body is supine like this. So it will be on the cerebellum. This is cerebellum. So it will be on the cerebellum. It will be on the dorsal lungs, not the ventral lungs. The dorsal side of the lungs, the posterior stomach wall, not anterior. The posterior stomach wall, dorsal liver, kidney, spleen, larynx, and lower intestine. So if you do the autopsy, you will find the lividity in the internal organs also. Common sense. Okay, gravity works everywhere. Got it? You have to differentiate lividity from congestion. Congestion before death versus lividity. So this table you can read by yourself. Yeah, the last thing in the lividity. Color changes. Okay, color changes occurs in various poisoning. I will teach you various types of poisons in the end. In the forensic medicine, I will teach you poisons also in the end. So in various types of poison, the color of the lividity is something different apart from purple, apart from blue and red. I told you till now bluish, purplish, reddish lividity, na? But in case of carbon monoxide poisoning, if death is occurring due to carbon monoxide poisoning, lividity is cherry red in color. If death is occurring in case of hydrocyanide, HCN poisoning, or death is occurring due to burns, it is bright red in color. If death is occurring due to nitrites or potassium chloride or aniline, the lividity is chocolate brown in color. Chocolate brown in color. In case of phosphorus poisoning, the lividity is yellow in color. In case of hydrogen sulfide, it's bluish green. Bluish to normal bhi hota hai, lekin it is greenish. In case of hydrogen sulfide. In case of carbon dioxide, it is deep blue color. So these are important for your MCQs, especially MCQ already asked on the cherry red color in carbon monoxide poisoning. So you should be able to learn it. You are getting my point. So learn the colors of the lividity in various poisons. Learn the color of the lividity in various poisons for your MCQ purpose. Okay. Chalo. Last thing. Why it is important? Why lividity is important? Medico-legal importance of lividity. What is the medico-legal importance of lividity? Can you tell me? There are 6 medico-legal importance. If I'm a forensic expert and this is a dead body, I can see the postmortem lividity. First thing is sure, it's a sign of death. Is it immediate sign? No. Is it late sign? No. It is early sign of death. So first I'm sure if the dead body is showing lividity, the person is dead. It's a sign of death. Number 1. Okay. Number 2, it can help me to calculate the approximate time of death. Okay, so there is no formula for that. Like cooling, we have the formula, but depending on the position, intensity, distribution, we can have an approximate time of death. Okay, it can mainly tell us the posture of body at the time of the death, because the lividity will be on the dependent areas unless and until the body position is changed after death. Okay, within few hours of death. Okay, it may sometime because of the repositioning, we can get lividity at 2 areas: the primary lividity, a fainted primary lividity, and an intense secondary lividity. So it indicates the body is repositioned after death. Okay, and it can also tell us the cause of the death, like carbon monoxide poisoning, the lividity is cherry red color, so it can give us clues like that. And it can tell us the manner of the death. For example, hanging. In case of hanging, the lividity is on the legs, hands, and genitalia. In case of drowning, there is absence of lividity if the constantly body is moving. So it can tell us the manner of death, cause of death, posture of the body, repositioning of the body, time since death, and sign of death. Learn these 6 things and you can understand all. I have given you ample of examples to understand all. So this is the medico-legal importance of the lividity. We are done with postmortem lividity. How many of you got it? Say, how many of you got it? Yes. So postmortem lividity, also known as cadaveric lividity, okay, and hypostasis. It is darkening after death. Many names I told you. You have to learn all the synonyms. What was the definition? Due to capillary venous congestion at the dependent areas, staining of the dead body occurs, and this staining is known as postmortem lividity. Mechanism, you know, mechanism is gravity. Okay, so when death occurs, you draw the flow chart. When death occurs, circulation stop. Circulation stop, axial blood flow. Gravity will attract the blood. RBC, WBC platelet will fall, and that will give the staining, and that will cause the lividity. Intensity depends on reduced hemoglobin. Okay, development, you know, in 1 hour it start visible. In 4 hours it is well established. In 12 hours it is maximum, and it persists till putrefaction. Okay, so this is what you have to learn in development progression. Shifting, if the body position is shifted, the primary lividity will convert into secondary in the new dependent areas, but primary position you will get a faint stains. At the secondary lividity you will get a dark stain. So it indicates the body is repositioned after the death, maybe to manipulate someone like that. And the extent of lividity depends on 2 things: volume of blood at the time of the death and the time taken by the blood to convert into the fluid. These 2 things decide the extent. So what decides intensity, what decides extent? Okay, distribution depends on 6 positions. Prone position, supine position, hanging position, inverted position, drowning, you know all the positions, lateral position, and you can draw the diagrams and tell the lividity. Okay, fixation, after 12 hours, blood vessels rupture, blood comes out and it becomes fixed. Even after changing the position of the body, it will not shift now. Absence of lividity in 2 conditions. What are the 2 conditions in which lividity is absent? Severe anemia and blood loss more than 65%. Okay. Internal lividity also occurs in the internal organs, on the dependent internal organs. You can enumerate the dependent internal organs in supine position, like cerebellum, dorsal part of the lung, dorsal part of the stomach, dorsal part of all the organs like that. Okay, color changes, you can it can give a clue of the poisoning. For example, in carbon monoxide poisoning, the lividity is cherry red color. And medico-legal importance, you know the 6 medico-legal importance. What does it tell us? So this is how you should be able to enumerate postmortem lividity. Got it? Can I come on the last? Can I come on the last sign of early postmortem changes? The most important, rigor mortis. Can I start rigor mortis? How many of you are ready with me? I can start? Say yes, people. Come on. Let me see the chat box. Yes. So let's start the last thing, rigor mortis. In the early changes, we are done with immediate changes, and in the early changes, we are already done with the 5. The 6th one, rigor mortis. Again, it's a long question. It's a long question for your university exam, and many MCQs are asked. Rigor mortis. So we will describe rigor mortis under these headings. So you have to learn the headings here, headings here, headings here. Others were very small. You don't have to learn the headings. But in these three, I appreciate if you learn the headings under which you are going to describe your answer. Okay. For MCQs, you can solve as it is. Chal, rigor mortis. So rigor mortis also known as, tell me other names of rigor mortis. Then tell me its definition. Most important is mechanism. Maximum rigidity at what time? After death. What is the order of rigidity? How developed? Fully developed rigor looks like what? How to test whether the rigor mortis have developed or not? Time of onset, what is the duration? And tell me the conditions which mimic rigor mortis. It's obstructing me. Can I do it down? I guess I will be audible. Okay, just a second. Yes, chalo. So you can see under which we are going to describe our answer. So it is also known as death stiffening or cadaveric rigidity. You can see the muscles are rigid. There is no table down this body. You can see the muscles become rigid after death. So I told you muscular changes in a dead body. There are three phases in muscular changes. As soon as the death occurred, the complete body relaxes. It is known as primary relaxation or primary flaccidity. We have already discussed that. Okay. After that, rigor mortis develop. The complete body becomes stiff. All the joints become stiff. You cannot move it. You cannot flex the joints. The complete muscles are very hard and rigid. This is death stiffness. This is second stage. Okay. So for 1 hour, there is primary relaxation. After 1 hour, till 12 to 24 hours, there is rigor mortis. And after that, there is secondary relaxation. When the rigor mortis ends, then there is secondary relaxation. Okay. It is also known as cadaveric rigidity. Death stiffness or cadaveric rigidity. Learn the two names for that. So whether you are getting a question on rigor mortis or death stiffness or cadaveric rigidity, the meaning is the same. Okay. What's the definition? You can see the rigidity. This is a dead body. Appreciate the contraction of the muscle. Appreciate the contraction in the arms. Appreciate. So postmortem stiffness of the muscle. Okay, why postmortem stiffness is occurring? There is no neurological component. Okay, there is no. It is due to chemical changes. I will tell you what chemical changes. Exactly what chemical changes. ATP got depleted. And because of this, all the muscles are contracting. Okay, as soon as the death occurs, some ATP is present inside the body at cellular level. So that ATP is utilized in relaxation. For relaxation, ATP is required. But when that ATP is depleted, exhausted, there is no more ATP, muscles contract because there is no ATP to relax it. So that is a chemical change which is causing so. Okay, it indicates cellular death, molecular death. At rigor mortis, when it is developing now, the cellular death starts. Okay, the cellular death is starting. It is indicating cellular death. So that is the definition. It is stiffness of the muscle due to chemical change, due to formation of actin-myosin complex. The actin and myosin are contracting because there is no ATP to relax them. Okay, so actin-myosin complex formation. This is the definition you have to write. Don't mug it up. Try to frame in your own language. So what is rigor mortis? It is muscular rigidness or muscular stiffness in the dead body. Postmortem stiffness in the dead body because of chemical changes, because of actin-myosin complex formation, because of lack of ATP. So mechanism, same thing is shown. You know, normally muscle fiber have actin and myosin. Physiology, first year, MBBS, you all have cleared, na? You know what is actin myosin? I'm not teaching is this, huh? How does relaxation occur? How does contraction occur? Can you see where is actin, where is myosin? You can appreciate actin and myosin, na? So you can see this is myosin, the blue one, the thick one is the myosin, and these red one are the actin. These are actin. So actin, myosin, how does they contract? For contraction, calcium is required. Whenever calcium is present in the sarcoplasmic reticulum of the muscle, calcium is released from the sarcoplasmic reticulum and they contract. You can see it is contracting. Z bend is formed. Yeah, that physiology padha hai, huh? So this is how contraction occurs. But when ATP is present, the complex is broken and they relax. So contraction require calcium and relaxation require ATP. I guess everyone knows this. See the video. You can see. This one is myosin, this one is actin. Okay, appreciate. They form the complex. Now this is contraction. Okay, then relaxation. Again contraction. Then relaxation. Then again contraction. Then again relaxation. I guess you can understand. For contraction, calcium is required. But for relaxation, ATP is required. I hope you got it. So during life, ATP is present. ATP is present. So relaxation occurs. Calcium, ATP both are present. So relaxation is easy. Contraction, I can contract my muscle. I can relax my muscle. Whenever I am contracting, the calcium is there. Whenever I am relaxing, ATP is present. ATP is constantly generated in a living body. But after death, there is no ATP synthesis. Okay. Oxidative phosphorylation in the mitochondria stops biochemistry. You know. So after death, ATP synthesis stops. Mitochondria is the powerhouse of the cell. You know, ATP synthesis takes place in the mitochondria. So ATP synthesis stops. The existing ATP also destroyed. Initially, some ATP, so suppose the person is dead. So initially some ATP is there. Okay, so that is causing primary relaxation for 1 hour. But after 1 hour, half hour, 1 hour, the ATP get exhausted. After that, you know, there is no more ATP now. There is no more ATP. Now, because there is no more ATP, there is no, what do you call, aerobic glycolysis. You know, in mitochondria, aerobic glycolysis, oxidative phosphorylation takes place in presence of oxygen. So no ATP generation. Now anaerobic glycolysis takes place. Anaerobic glycolysis leads to generation of lactic acid. Lactic acid. When there is no ATP, body is trying to generate the ATP with the help of anaerobic glycolysis. So lactic acid generated, which will cause fall in pH. Fall in pH will cause rupture of sarcoplasmic reticulum. That will release the calcium. Now two things are there. There is no ATP, there is abundance of calcium. There is no ATP, ATP khatam, and there is abundance of calcium because of rupture of sarcoplasmic reticulum. Both of these will cause sustained contraction of the muscle, and that's cause rigor mortis. I told you two things now over here. I told you for contraction, calcium is required, and for relaxation, ATP is required. You remember, for contraction, calcium, and for relaxation, ATP. So I'm saying after death, two things are happening. Number one, ATP synthesis stop. ATP synthesis stop. And existing ATP also depleted one time. Okay, so this is regarding the ATP. Now body try to generate ATP with anaerobic glycolysis, and body will generate the lactic acid. Lactic acid will cause fall in pH. Fall in pH will cause rupture of cytoplasmic reticulum, and that will cause increase in calcium. So two things are happening. There is no ATP, there is abundance of calcium. Calcium causes constant contraction, and since there is no ATP, there is no relaxation. There is only calcium, there is no ATP. Okay, why there is calcium? You have to understand that also. Calcium is due to rupture of sarcoplasmic reticulum. Why sarcoplasmic reticulum is rupturing? Because of fall in pH. Why fall in pH? Because of lactic acid generation. Because there is no ATP, now body is trying to generate it with anaerobic glycolysis. So lactic acid generation, which is causing fall in pH in the cell, in the myofibril. Okay. So this is how constant contraction takes place. That is known as rigor mortis. People, give me a thumbs up. I'm trying. Say, got it? So this is rigor mortis. You can see this is a dead body, but it is contracted. Appreciate the muscles. Appreciate the muscles. Appreciate the muscles which are contracted. Rigor mortis. Constant, sustained contraction of the muscle in a dead body. After initial relaxation. Initially there is relaxation. After that there is contraction. Initially there is relaxation because residual ATP is there. Once the residual ATP is exhausted, there is contraction. So this is known as rigor mortis. Maximum rigidity occurs when ATP drops to 15% of the normal. ATP drop. When ATP is less than 15% of the normal, maximum rigidity. Okay, and lactic acid keep on increasing. So ATP keep on falling, lactic acid keep on increasing. ATP fall to 15% and lactic acid increase to 0.3%. Normally there is no lactic acid, but it is increasing to 0.3%, so it is maximum rigidity. These are for your MCQs. Okay. Rigor mortis always develop in all dead bodies. Gradually it disappears. It always develop in all dead bodies. What is the order of appearance? In what order the muscles contract? There is a particular order that follows Nisten's rule. Via Nisten's rule, I will tell you the order. All muscles contract, whether voluntary or involuntary. But there is a rule. The Nisten's rule says that first involuntary muscle contract and then voluntary muscle contract. So learn the Nisten's rule. For rigor mortis, we are having this rule. Nisten rule. First involuntary muscle contract, then voluntary muscle contract. In the involuntary muscle, first of all, heart and other viscera. Okay, heart and other viscera will contract. Heart and other viscera. First organ to contract is heart. Internal organ. Involuntary muscle. In the involuntary, heart and other viscera will contract. Okay, now coming on the voluntary. Voluntary means first of all, eyelid. Eyelid will contract. Eyelid. After eyelid, neck will contract. Then lower jaw will contract. Then face, entire face will contract. Okay, then chest muscle will contract. Then upper limbs will flex like this. Okay, then abdomen, then lower limb, and finally the fingers and the toes, the last to contract. You have to learn this order. Okay, we'll try again. Chalo, one more slide, we will try again. Say, bina dekhe, without seeing that, you try here. First heart will contract, then eyelids will contract, then neck will contract, then lower jaw, then entire face, then chest, then upper limb, then abdomen, then lower limb. Very easy. Chest, upper limb, abdomen, lower limb. Bolo. Chest, upper limb, abdomen, lower limb. And finally, fingers and toes. Fingers and toes. So easy to learn, not very difficult. Nisten rule. Which rule? Nisten rule. So this is order of contraction. You can see the dead body is contracted. Appreciate the contraction. Appreciate the rigidity. Appreciate the stiffness. So stiffness, rigidity, that is rigor mortis. Okay. Now, what are the developmental features? It is independent of nervous system. It is due to chemical changes, that is depletion of ATP and increased calcium concentration. Two chemical changes are there. ATP nahi hai aur calcium bharpoor hai. There is no ATP and abundant of calcium, which is causing rigor mortis. So there is nothing involvement of the nervous system. I will tell you cadaveric spasm, which mimic cadaveric rigidity. This is cadaveric rigidity. Cadaveric spasm is due to nervous system, but this one is not due to nervous system. Suppose the person who is dead, when he was alive, the person is paralyzed. So in a paralyzed limb, does the rigor mortis develop? It's an MCQ. In a paralyzed limb, rigor mortis develop or not develop after death? Suppose the person is paralyzed. Suppose this limb is paralyzed when the person was alive. So after death, in the paralyzed limb, it develops slowly. It develops slowly. Okay, got it. Before the full rigor mortis develop, if the body position is changed, then there is re-establishment. Okay, suppose it is stiff and I am breaking the stiffness. The stiffness can be broken. It is very stiff. It takes efforts to break the stiffness, but it can be broken. Once it is broken, it will re-establish, but re-established rigor mortis is weaker than the primary one. Like the lividity. In the lividity also, there is re-establishment, but their secondary lividity was strong than the primary. Here, primary remains strong. The secondary one will not be that strong. Okay, and frequent handling of the dead body will break the rigor mortis again and again. Okay, if the dead body is frequently handled, suppose death occurs in some city, some other country, so dead body is carried and multiple handlings occurs at multiple times, so rigor mortis can break. Okay, so these all things should be considered to the forensic expert who is examining the dead body and examining all these features. So this all history is important. Whether there is handling of the dead body, multiple handling and all that, whether the position of the dead body is changed after the scene of the death, like that. Okay. Now when there is fully developed rigor mortis, tell me the features. The entire body is stiff. Can you see the entire body is stiff like that when fully developed rigor mortis after 12 hours. Okay. Muscles are short and hard. All the muscles, you will see they are very hard. If it is like this, you take efforts to open in a dead body. Okay. So the muscles are short and hard. Major joints are flexed. You can appreciate the major joints are flexed. All the major joints, the knees, the elbows, the shoulders, they are flexed in a dead body. The fingers and toes are strongly flexed. It's not visible here, but fingers and toes are very strongly flexed in a dead body. So these are the features. You can appreciate the fingers are like this in a dead body when the rigor mortis is developed. You know this muscle, erector pili muscle. What is this muscle? This muscle is present in the skin, na? That causes goose flesh, erection of these hairs. Okay, whenever we feel cold or whenever we are excited, whenever we fear, we have this appearance because of contraction of erector pili. So erector pili muscle also contract along with all other muscle. All the muscles are contracting, na? So erector pili muscle also contract. So dead body have this appearance. It is known as goose flesh appearance, or also known as cutis and serina. So this appearance is there in the dead body. Okay. Dartus muscle also contract. Dartus muscle in the males, in a male dead body also contract, and that cause semen discharge after death in the male. When the rigor mortis sets, the semen discharge takes place in a male dead body because of dartus muscle contraction. Suppose there is a lady who was in labor and she got death, maternal death. I teach you maternal death in community medicine. Yes. So if a maternal death, when there is a lady who is in labor, a pregnant lady who is in labor and she dies at the time of the labor, when rigor mortis sets in that pregnant lady who have the fetus in the uterus, whether the fetus is dead, mostly the fetus is also dead. So uterine muscles also contract in rigor mortis, and sometimes it can lead to expulsion of fetus in a dead body, pregnant dead body. The expulsion of fetus takes place during rigor mortis. Got it? Facial expression, I told you na, here face also shows rigor mortis. So face ka which muscles show rigor mortis? The muscles, we have various muscles on the face, na? Some muscles contraction cause smile like this. Some muscle contraction cause exclamation like this. Okay, and some muscles called like grimace and dukh, sad, like this. Okay, so which muscles are contracting in rigor mortis? So in rigor mortis, the muscles which contract give a grimace face. Right. So dead bodies are like upset, they are not happy. Okay, when the rigor mortis settle, okay, so on the face it's a grimace wala expression the grimace expression, the sad expression, because the muscles which are contracting during rigor mortis gives a sad expression on the face. So dead bodies have a sad face because of this facial muscle contraction, the grimace expression. I hope you got all the features of the rigor mortis. How to test it? Try to open the eyelid. If you need resistance to open the eyelid, it means the rigor mortis have already developed. Okay, so lift the eyelid. If it is resist reopening, so it means the rigor mortis have already started developing, or it is fully developed. This is the easiest test to test the rigor mortis. Okay, now what is the onset? It starts 1 hour after death. Till 1 hour it is relaxation, primary relaxation. After 1 hour it starts. It fully developed in 6 hours and it disappears in 36 hours. After 36 hours it's secondary relaxation. Okay, so duration in summers it's 36, in winters it's 48. Okay, got it. Now the last thing, conditions simulating rigor mortis. Very important. It's a very important MCQ as well as university question. There are 3 conditions which simulate rigor mortis. They are not rigor mortis. Heat stiffening, cold stiffening, and cadaveric spasm. Among them, the most important is cadaveric spasm. This is instantaneous contraction after death, not after 1 hour. Rigor mortis develop after 1 hour. This one is instantaneous. Okay. Heat stiffness. Have you ever imagined the death occur because of hot liquid immersion? Suppose it is a boiling oil and someone fall in that, the complete body, the person will die. Obviously, hot liquid immersion or high voltage shock or burns. In all these conditions, the body looks like this. Can you see the body is contracted? But this is not rigor mortis. When the body dies, at that time, if the body temperature is more than 65 degrees, in case of burns, in case of high voltage shock or hot liquid immersion, like this. Okay, can you see the body? You may think, ma'am, is it rigor mortis? No, it is not rigor mortis. When death occurs in such a condition, when the body temperature is more than 65 degrees, it is known as pugilistic attitude. What is known as pugilistic? The limb flaps due to muscle contraction. So at the time of the death, the person is contracting all the muscle and person dies in that condition only. So from death itself, it's like this. It is not rigor mortis. It is mimicking rigor mortis, but it is heat stiffness. Because a death occurs when the temperature of the body is more than 65 degrees. Okay. Here rigor mortis does not follow. In such case, don't search for rigor mortis because the muscles are already contracted from the time of death only. And this is known as pugilistic attitude. You get an MCQ on that. Pugilistic attitude seen in heat stiffness. The death due to heat. Okay. Number 2, cold stiffness. Okay. Suppose the death occurs due to frozen. Someone is locked in the cold room. Have you watched that series? You don't watch series, movies, something. So if the temperature is -5 degrees or lower than that for hours, the person will die definitely. For many hours, someone may be accidentally locked in cold rooms, in freezer, like that. Okay. So subcutaneous fat will solidify. The person's subcutaneous fat will solidify. Okay. And if you do forcible, complete subcutaneous fat is solidified like ice. If you touch it, you may feel it's ice. The tissue is like ice, hardened like ice. And if you flex it, you will hear the voice of cracking of the ice. Okay. So forcible flexion, ice in the joints may crack, sound like a crack of the ice. Okay. On warming, stiffness disappear. But here, if you warm the body, okay, in warm water or what, it will stiffness will disappear and then rigor mortis will develop. In heat stiffness, rigor mortis don't develop at all. Pugilistic attitude is permanent. But here, this flexion is temporary. On warming the body, this will disappear, and after that, the rigor mortis can develop. And last is cadaveric spasm. Here, the reason is neurogenic. It also mimic rigor mortis, but it is not rigor mortis. It occurs immediately after death. When at the time of the death, the person is in excitement or fear. Okay. At that time, because the person is in intense emotion like fear, anger, or excitement, or cerebral hemorrhage, head injury, drowning, strychnine poisoning, in all these conditions, adrenocortical exhaustion takes place. And that will stimulate the brain, and that will cause this spasm-like condition. It is neurogenic in origin. In contrast to rigor mortis, which is not neurogenic in origin, which is chemical in origin. The rigor mortis is due to less ATP or ATP exhausted and high calcium. This one is neurogenic in origin because of adrenocortical exhaustion. Okay, so you should be able to differentiate the rigor mortis from the cadaveric spasm. The rigor mortis develop after 1 to 2 hours, but cadaveric spasm is instantaneous after death. This occur in all muscles, voluntary and involuntary. This one occur only in few muscles. voluntary, not involuntary. Here the origin is chemical. Here the origin is neurogenic. Okay, here outcome overcome by force very easily. This one is requiring great effort. Cadaveric spasm, you can't open it. Once the fist is there, you can't open it. It's require great efforts, very great efforts. Okay, so you have to learn these differences which are important. That's it. So this is how you can revise the entire rigor mortis in 1 minute. If you have written these headings and all the things you have understood already, you can revise it in just 1 minute. So you make your notes like this. People, this is a way to make the notes. Got it? This is how you can revise. So we are done with the immediate postmortem changes, which are 3 in number, which are done with early postmortem changes, which are 6 in number. The late postmortem changes, I guess I will take tomorrow because it's too late now. I'm also tired. So this I will take tomorrow. That's a free session. I will take either this tomorrow or I will put a recording this on the app and I will teach the another topic tomorrow. Maybe I will take this first and then start the another topic also. Okay. So tomorrow also we are having a free session of FMT only. The topic is not legal procedure. First I will finish this and after that I will take a very important topic, impotency and infertility and abortion. These important topics I'm going to take tomorrow. But the session is on app. So please do watch it on the app. MedLive by Dr. Priyanka app. The session is on MedLive by Dr. Priyanka app. The time is same. It is a free session. The only thing you have to download or install the app. The link to download the app is given in the comment section. It is pinned in the comment section. Please go on that. If you have not yet downloaded the app, please download that. And session is absolutely free like the YouTube only. You may be thinking why we are taking it on the app, not taking on the YouTube only if it's free. Because on app we have a features of polling and other features also that will, the session will be more engaging. So tomorrow you can realize and it will be a super duper hit session like today's also. And you will learn a lot. So don't you dare to miss tomorrow's session 6 p.m. on MedLive by Dr. Priyanka app. The topics I told you, the important topics, first we will finish it and then we will continue with other important topics. For any other query, please WhatsApp on this number. Calling is not available, only chat, WhatsApp is available. Please note down the number. For any query, you can WhatsApp on this number. Thank you so much. Hope to see you tomorrow, 6 p.m. Forensic Medicine on MedLive by Dr. Priyanka app. It's a free demo session. Okay, everyone please join. Thank you so much. Bye-bye. Good night. Hope you enjoyed and learned. Okay, chalo. Bye-bye. Bye-bye. Good night. I'm ending the session. Chalo.